trouble with coming home today or getting?
I did not, because I took the C, but yeah, we were saying a little bit earlier that the whole thing with the one train.
It's completely shut down. 1, 2.
Oh, wow, I didn't realize they were shut down.
Yeah, they had derailed.
I saw that. It was like I think it was like a collision and
Yeah.
then, yeah.
People were. I don't think
Derailment
badly
due to a collision or two separate
I think
issues?
it was a derailment due to a collision,
That's
but
good.
I mean, they're lucky because they basically said the trains were leaving. One was, I guess, stationary and the other one was leaving the station. So the impact wasn't as significant as it would have been if they'd been going 35, 45, nothing happened.
Right.
yeah.
Still, you don't hear about that
Oh,
every
wow.
day. It's crazy.
Yeah. I know my husband's trying to get home.
Um,
He's waiting it out a little bit.
yeah.
So
Good luck
my,
to him.
He's not gonna wait it out to try to get that. I mean, that's shut down till tomorrow, but just make it a little easier because traffic.
Yeah.
my husband took the Metro North, it's 20 minutes from Grand Central to Marble Hill,
Mm,
it's just 20 minutes, so you need to do the walk
That's a
to the
smart-
walk,
That's a smart idea.
you know, the subway to the Metro North, and then you walk from Marble Hill, so just not too, it's about the same time as if you would take the subway for us.
Uh-huh. Does he do that all the time?
No,
No.
he just did it today because of the
Problem.
train issues. There was another train with some issues. There's the one, and there was something else going on. Oh, I don't know. Yeah, so. We'll wait for Steve for a few more minutes.
Oh,
This meeting is being sent to a third party?
Oh, usually it's streamed to Facebook and I think they're
Oh.
still setting that up. Yeah. So
Can I ask you guys, you probably weren't here, but you remember last year around March,
or streamed.
we had I think it was in coordination with housing, a person came and talked to us about rat mitigation and, you know, everything that she's doing and her. Do you remember that? And, you know, you could call her and give addresses and she would go out and with us.
I don't recall that.
I can't find the minutes and I don't have it in my notes. Jacob, do you remember anything about that? Do you remember?
So what was this? I
Person,
wasn't paying
I
attention.
think it was around March where we had someone, and I think it was in coordination, we had a meeting with housing as well, and somebody came and talked to us about rat mitigation.
It sounds familiar, but I don't remember off the
No,
top of my
okay.
head, and I don't know that I was taking minutes. So
Yeah, I
actively
don't
at the
think you were,
time.
I don't think you were taking minutes.
Because otherwise
I looked in my own
Hmm.
notes and I couldn't find it, and I couldn't find a March 2023 minute.
Let me see if the old minutes are on the website.
Hi, good evening, everybody. My name is Claudia Copeland from NISNA. Nice to see everybody.
Hi, welcome.
Hi, I'm Ned Gartour, also with NISNA's Political and Community Organizing Department.
Great, welcome to our meeting.
Thanks for having us tonight.
All right. Yeah, we're waiting a few more. We are muted, right?
Yeah.
Yeah.
Okay, we're waiting a few more minutes for Steve. And then we'll start. And then Lisa.
Hey, Carmen. Hi. How are you? Happy New Year.
Looks like most of the minutes on the website are only for 2022, so we should probably figure that out. But
Well, I thought maybe housing may have taken the minutes, but they don't have a March
yeah, no.
one either. And I
There's anything
could
from
be
this
wrong
year.
about the month, but it's
Mhm.
the one I was sort of hoping, because there's a building on my walk down from my building that just rats are flying out of there, like every time,
Oh,
every time you walk by it,
Yeah.
2 or 3 rats shoot across the a sidewalk, and I said, that would be a good one to send to her.
Yeah, yo lo tengo on YouTube. It's here
Sí, yo lo
that
vi en YouTube.
I can't see the thing that you showed me. I can't find it. I already have the link copy. Yeah,
Here.
it's a little different here, right? Now, I went here. And what would it be? Would it be a post? Would it be a live? Because, oh, sorry, it was here more. We could pick what we want to put on from there, but I don't know which one it is.
Well, I don't know how to.
How about you go to about?
Yeah, how are you?
Maybe we just leave it.
Good,
No?
good.
Very good.
Different here, let's see, switch. And then come back.
Yes, it's there now.
Mhm. So what is?
Health.
Okay. Hey, Steve. Happy New Year.
Content of this meeting is being sent to a third party.
Yeah,
It's very.
yes, scary.
Yeah, it's there. And now you post it, right?
Mhm.
Okay. Okay, now post what you did then.
Oh, I spoke to, someone about Recruit Me
Mhm.
at Columbia. She's like a research coordinator there. And she said she would be willing to come and speak to us, but only in her capacity as a private person and not on behalf of Columbia.
Oh,
Or right, or otherwise we could reach out, they have like an outreach team, I guess, that does outreach for the research, so we could just reach out to those people instead. Yeah,
See if anyone wanted to come.
Yeah.
talk about-
yeah, I figured like I would ask, but
Say again, what's his name?
if you need an agenda, we have an agenda here.
There's some back here for the public. Those are for you in case you run out.
Oh.
Okay.
but yeah, that's
I
the
think it'd
last
be
call.
nice to get the information out to the
Yeah,
public, just.
um.
FYI, I left my, tea bag on the side. Yesterday I did that and somebody tossed it out. Please don't toss it out. Because I don't like my tea to be like too dark, so I
You can
kind
reuse it later.
I reuse it for another cup, yeah. So.
But don't throw that tea bag out.
I should put a sign.
Put your name on it.
Yes.
On a tea bag. Actually, it might be worth seeing if they have some kind of like email blast of like, here are SERP studies, because then the office could circulate that blast,
Bring
right?
it up under new business.
Yeah, that's it.
Happy New Year.
Yeah,
Hey. Hey. I made my Pharaoh mission. I did. Yeah. I'm so jealous. I didn't get the feet of that. So I said,
yeah.
That's the problem. You can't get me down. No, you can't get me.
Thank you, sir. Right, so the meeting has not yet begun.
No, we didn't start it
Okay.
because,
Okay.
you know, I didn't see any text from you, so I figured you're
You have 10 minutes?
Sorry?
You can do that?
Yes,
Oh, great.
awesome. Thank you.
no problem. You are welcome. I'm all set over here.
All right, so what do I have to do to start the meeting?
Call it to order.
But is it running?
Yeah,
It's
it's
already,
running and
already-
it looks like we're good.
yes.
Oh, shoot, okay. All right, welcome everyone to the Community Board 12 Manhattan Health and Environment Committee meeting for January the 4th of, believe it or not, 2024. Which hopefully is going to be a very good year, but we'll let you all know in about 11 months. Want to welcome my fellow committee members. My name is Steve Simon. I'm the chair of the committee. I'm joined by O.C. Kamada, my assistant chair, by Elvin Adamus, Jacob Banis, Heidi Guzman, and Jody Herson. And I wouldn't be surprised if maybe one or two other committee members show up. But in any case, we have a quorum
Carmen.
and,
Sorry.
oh, and Carmen Paulino. I don't know if anyone else is going to show up now. Because Carmen was who I was counting on. So let's begin the meeting. We have a pretty full agenda as usual. We've been approached by the New York State Nurses Association, which comes to us every now and then to inform us of issues at New York Presbyterian Hospital. And apparently the latest issue now is the fact that I believe 5 nurse midwives who are working at the Allen Hospital further up in Inwood have been sent a letter from the personnel department at Allen informing them that the hospital is eliminating their positions effective on or around February the 1st of 2024. And this letter goes on to say that should you choose to remain at NYP, we will work with you to secure another position at the hospital. A meeting will be set up with you and your representatives to discuss these changes and potential impact to you. We will contact you shortly with those details. The letter itself does not explain why this action is being taken. We have heard from representatives of the hospital that the plan is to merge the midwife program with the OBGYN program, which is run directly apparently by Columbia University as opposed to the hospital. But it's unclear at the moment, I guess, what that means for the people who are currently serving as nurse midwives at the Allen. But we're about to hear from, I think, at least 2 of those nurse midwives. Nicholas, should I begin? Do you want to set the stage for your group?
Yes, I'm going to defer to my colleague Claudia Copeland, who works directly with the midwives at the Allen Hospital, and
Okay.
can set the stage and introduce our midwives to the committee. Thank you so
very
much.
good. Yeah, very good. Claudia, tell me what your position is, I guess, with the union.
Sure. So, hi, my name is Claudia Copeland. I am the union representative for the Allen Hospital, as well as some of Milstein, but we're focusing on the Allen tonight. As you stated earlier, it's seven impacted advanced practitioners, 6 midwives and a nurse practitioner who received the notice on December 4th that the midwifery services would close on February 1st, 2024. The letter states that we had a meeting earlier today with management, and the date has now been moved to March 3rd, 2024. As you stated, they're claiming that they want to merge or not have a fragmented reporting system which just FYI, anywhere with MPs or residents, they have the same system throughout the hospital. So this is not a new model. This is not the only group that has that model. And while the letter states that they will be able to have employment through NYP, our concern is that having unionized midwives, which 3 of them are on, allows for patients to have the best care, especially Black and Brown patients in the communities of Inwood, Washington Heights, and the Bronx. When our midwives are able to have work conditions where they can voice their concerns, which being part of a union, they're able to do that, they are able to actually give great care to the communities that they serve. And Rosalina Lozada, who's on and is a midwife at the Allen, is not only a midwife at the Allen. Rosalina was raised, is born, raised, lives in Washington Heights, was inspired by her experiences there to become a midwife. Allison McDonald lives in the community as well, and it proudly serves the community she lives in, as well as Michelle Hanselman. These are the 3 affected midwives, and I just want to say Rosalina is currently taking a moment while she is at work. This is deeply, this will deeply impact and exacerbate the ways in which Black and Brown women and birthing people are treated at the Allen, and we are deeply concerned. And I'm going to turn this over to Rosalina, Allison, and Michelle to talk about how this will impact the community and why it's so important for the community to be involved in this fight.
All right, and
Okay.
and certainly they all get extra points for living in the community.
So I
so-
guess,
Is
guess
Alan
mi-
first?
Rosalina.
Rosalina. Okay, go ahead.
yes, I'll go first because I'm actually at work.
Oh,
Mhm.
okay. Well,
so-
I hope you're not going to get into any kind of trouble, are you?
No, I'm beyond that. I'm fired. So I'm beyond that right now.
Oh,
So good evening, everyone. So I actually arrived at Washington Heights on June 10th, 1970. So I have lived here almost all of my life. I moved away for 15 years of my life and made the decision to come back and raise my family here. So beyond us, being fired and not having a job, I mean, which we can get a job. We are employable. My personal concern is the women of this community. Our population, which is, they have public insurance, is more than 80% of the population here that delivers is Dominican. Many are non-English speaking. There's 3 of us here that are native Spanish speaking, and the rest is a very small percentage that use private insurance. So when we exit on March 3rd, on March 4th, the hospital has not given us any real tangible explanation or plan as to who is going to fill our void. Because presently the physicians are overworked and very short. The Columbia University has a recruitment and retention problem with the physicians because of how hard they work here. The word is out. So we lost 5 physicians last year and they were replaced by only 1. And this has been happening over a course of 5-6 years. So they are terribly short. So presently, it's bare bones, even with the 2 physicians that are on and 1 or 2 midwives on, or 1 midwife and 1 nurse practitioner. It is not enough to cover when our census is very full, when the physicians are occupied in the operating room or when they are occupied in the emergency room. And that leaves us to quote unquote manage the board to make sure that all the baby heart rates are fine. If anyone needs to deliver, we will then go ahead and we will help with that birth. And what New York Presbyterian is saying, they've sort of washed their hands of it, like Pontius Pilate, and said that they have transferred that to Columbia University, and Columbia University will take care of that. And today they said that they have always taken good care of the patients. And if anyone keeps up with current events, they will know that New York Presbyterian and Columbia University does not, in fact, take care of women with cases that have been in the media. So that is our concern, that and the physicians are concerned as well, and the nurses also are tremendously frightened because the women are going to be left unattended when we exit. There's not going to be anyone here that's going to replace us in time.
Rosalina, can I ask you, how many babies do you help deliver?
Well, that's a funny question, because our scope of practice was limited in 2003 because of billing issues. The hospital was caught doing financial malfeasance. They were doing double billing. And so what the university's solution to that was to limit the amount of births that we actually do, because that way the physicians can bill for the births, and the reimbursement will go to the university and the faculty practice. So when the midwives currently do the births, the hospital is who receives the reimbursement. And Columbia University doesn't want that.
All right, but put that aside for the moment.
Right. So
Well,
presently, so the births we can do anywhere from 2 births to 12 births to maybe 15 births a year. It depends on what is going on the floor, but we do not actively manage labors anymore because they limited our scope at 20 for 20. It's been 20 years. And so it's hard to predict, when we come on, if we're going to be able to do a birth or not. It's unpredictable.
So mostly then you're providing prenatal care?
What we do is triage. Every woman that walks in through the door, we encounter. We do all the triages and we do all the admissions.
All right.
I have a follow-up.
Yeah. Heidi, go ahead.
This is sort of a corollary, I guess. What would you estimate is like your patient ratio to midwife or to nurse?
Oh, well, we don't carry a patient load. We don't have a patient assignment. But the triage, we can treat in a 24-hour period. There can be 1 or 2 triages to 25 to 30. The ebb and flow is very unpredictable of the labor room. But nurse to patient wise, it can be anywhere from 1 patient to a 1-on-1 to 3 to 1, depending on how busy the unit is, because the ebb and flow is so unpredictable.
And if you don't mind, you have you have a lot of different initials after your name. So MS is obviously what
it's a master. So I have a bachelor's in the science of nursing, and I have a master's in the science of nursing. I'm a certified nurse midwife, and I'm also a women's health nurse practitioner.
Okay, that's what those other initials are.
That's what the WHNP is. Yes.
Say it again. It's what is it?
WHNP is women's health nurse practitioner.
Okay, very good. All right. And has so what they've said is that this midwife program would be subsumed under Columbia's OBGYN department, I believe. And so have you heard from Columbia? Has Columbia have they suggested that you could now be employed by Columbia?
No one has approached us from Columbia, nor no one from NYP has made us that suggestion or made a bridge or any facilitation of any kind.
Oh.
No.
Okay, well then I don't quite understand. All right, well, I'll tell you what, if you don't mind, we'll move on now to.
Not at all.
Okay. All right. Well, and if you have to go back to work, please do that. So is Allison next or Michelle?
Allison and then Michelle.
Okay, very good. Okay, and Allison is an MSN. So
that's a Master of Science in Nursing.
Okay. And then you're also a master in public health, and
Yeah,
then you're
Master in Public
certified
Health.
and a nurse midwife, and LM is,
That's licensed midwife. That's just
Okay.
another way to say certified midwife.
all right, so also someone with plenty of credentials. Yeah, I'm sorry, I didn't mean to stop you.
Oh, no, thank you. So my name is Allison McDonald. I'm a midwife at the Allen. I'm a resident of Washington Heights for 15 years. And I don't really have too much to add to what Rosalina stated. I mean, she laid it out very clearly. The main issue here is that the service is going to be very understaffed come, I guess now March 4th is the date. Because to get, if Columbia's plan is to hire their own midwives through Columbia, the process of getting people credentialed, it's like a very extensive background check, and it takes, basically it tends to take 6 months. So if we are leaving March 1st and they are hiring people now, there's going to be a large gap of time with no midwives. And we are, as Rosalina stated, we're really chronically understaffed at the Allen, and we're often in situations where we're having to do things that are kind of outside of our scope. There are not enough doctors, so we're assisting with C-sections, even if we may not be certified to do so. And it just seems that Columbia NYP have carried this out in a way that is putting people in danger. And we, of course, we're upset about losing our jobs, and we are also very concerned about how the service is going to function once we leave. And our colleagues, our nurse and doctor colleagues, are very concerned as well. And there doesn't appear to be any plan in place to protect the women and birthing people at the Allen come, March 4th.
I don't know, am I missing something here? Is there a reason that you can't just be hired by Columbia? Why you couldn't just be, I mean, if this is like a bureaucratic shift from one institution to the other, why you couldn't just be hired right away by Columbia?
There are a few. First of all, nobody has approached any of us to offer such a thing. In addition, many of our midwives have been with NYP for a very long time, and they have certain benefits, pension and health insurance, that are not necessarily easy to transfer.
No, those would have to be protected.
So, that's one issue, but also truly nobody has spoken with us to say, hey, we'd like to hire you under Columbia.
Well, that seems unfortunate. OC, you have a question?
Yes, could you describe to us some of the issues, problems, risks that could potentially happen because the unit now will be understaffed?
Yes. So to be fully staffed, we consider on our unit to have 3 doctors on and 2 midwives. We very often these days have 2 doctors and 1 midwife. And, we may have a couple of patients, laboring or there for evaluation, or we could have, 10 patients and a few more in the waiting room. And so you may have multiple patients giving birth at the same time. You may have 2 patients needing a C-section at the same time. You may have people coming in with an emergent situation. And, when we're fully staffed, it's a busy night, but we can handle it. But when we have 3 providers instead of 5, it can be scary. And you're like, one doctor is coming out of the OR too early in order to do something, and we're doing things outside of our scope. And if we're gone, the situation is even worse.
So are there any risks to, let's say in case of complications, any risks to mother and babies? And,
Yes.
And so is lives on the line here?
Yes.
Because the unit will be understaffed? Okay. That
is what is happening, because if 2 doctors are in the operating room with a patient and another, a heart rate goes down and can't come up, and we need to go bring that second patient, you know, we really don't, there's not, you need two people to be doing the surgery. So those two doctors are already in there. Then what happens? This patient needs to have an emergency C-section, or else the baby will not survive the birth. So
And
that's a very realistic scenario.
could you also, I don't know who can answer that. Could you tell us, what is the composition of the, how many residents of Inwood, Washington Heights do you see in a given year? Composition of like, are they like white, Hispanic, African American? What's
mostly Hispanic, Latino. Like, I don't know if anybody knows the exact numbers, but I would say high majority. And some Black patients, very few white patients, very few Asian patients.
okay? So
There's about 180 to 200 births a month.
okay,
I'm sorry, one more time, 180 to 200?
yes.
Okay, and that was Michelle Handelman, who we
Sorry
have.
to interrupt.
That's all right, but for the purpose of the minutes, and we'll get around to introducing you formally in a moment. Back to Allison. Did you want to respond?
Oh, no, that's all. Yeah.
Okay, all right, very good. And one of our board members, Hannah Ney, has a question. Hannah, you want to go ahead?
No, not at the moment.
Oh, okay, very good. All right, well, thank you for joining us. All right,
Thank you.
Any other questions? No? All right, so thank you, Allison. Now, Michelle, this is actually now your turn.
Okay, hi, sorry. So
But 1 second, Michelle. You have something called an FNP. So that's some kind of nurse practitioner.
yes, family nurse practitioner.
Oh, family nurse, right? Okay, all right. And plus you have the MS, the CNM, and the LM midwife. So all of you have at least 4 credentials. Okay, very good. Go ahead, Michelle.
Right. All midwives practicing in New York are licensed midwives. Some of us are certified nurses. Some of us are certified midwives without the nurse. Up until this point, all the midwives at the Allen have always been certified nurse midwives, but the state does certify non-nurses. So I've only been at the Allen for 4.5 years, and I have moved to the community. I live just on the edge of Kingsbridge, Riverdale.
Hold it 1 second. Oh, that's outside of our community. I have to. I have to,
but the Allen community. Sorry,
I have to deduct the extra points I gave you earlier. I'm
okay,
sorry.
Sorry. Strike
You
one.
you just lost the bonus points. Okay, go ahead.
Sorry, but I feel
We're
a part
very
of the community.
protective of CB12. Very protective
Right.
of those lines.
Okay,
Absolutely, yeah.
I walk to work and I see my patients while I stroll down Broadway. So
that's good.
I feel like
That's
it
good.
counts as a community member.
Okay.
Okay, so as sort of someone who hasn't been here quite as long, I have to say that the quality of midwives and the nurse practitioner who work at the Allen, though we have this truncated role based on things that happened in the past with Columbia University, it's not the same role that I've had in other places where the midwives did more deliveries than we do here, although I do catch a baby at least once a month, maybe more. The quality of midwives that you have at the Allen are very experienced, very connected to the community. Like I said, I think more than 4 of them are fluent in Spanish. There's high proficiency in a number of others. I think the experience of women who come to triage at the Allen, and the person who is the first one who meets them, the first one to assess them, is someone who's fluent, who's someone who they can really communicate with, is very profound influence on the quality of care. I think that as a relatively new member of the team, the 3 of us who do work days, and we primarily do the admissions and the discharges and all the postpartum teaching, and we round on all the postpartum patients. We were recruited. We decided to come to this job because of the benefits that NISNA afforded us, including pension. So to say, oh, we should jump over to Columbia because they invited us or didn't invite us or decided they're going to restructure the program, there's issues. We were recruited. There was recent leadership change in our department. The chair of OB resigned and there was a new chair, and the new chair came and she spoke with us about expanding the role of the midwives. And I have been an activist. I've always believed in promoting midwifery for women in the city. There's many reasons why, keeping birth process normal and, the focus that midwives have on communication and education. It's different than a medical model. I've also always worked in hospital settings where I was part of a team with the medical providers. And when our new chairperson came to us and said, we want to expand midwifery, we said, great, here are the issues we think we're going to have here. We can't hire CMs. There's certain things that need to be developed in order to have a successful midwifery practice. And we said, great, we want to work with you. We want to do this. And next thing you know, our lines are being eliminated. Maybe they're going to hire new midwives. I know the Columbia job is posted, but why not work with the 7 experienced providers that you have? And the other thing that's most troubling about this is the fact that every time we asked NYP, well, what's going to happen on February 2nd and now March 3rd, there's no way this was a 7-week notice, no way within 7 weeks you can recruit, hire, credential, train new providers to replace 7 very, very experienced providers who, I guarantee you, any emergency that comes into that Allen Hospital, if doctors are in the operating room, if doctors are busy doing something else, those midwives know how to handle that emergency, know how to assess, is this something that I need to pull someone out of the OR for? Is this someone that I need to start a massive hemorrhage protocol for? Is this someone I need to gather more help, or can I manage this case on my own? And, that's not necessarily the case if you replace these midwives. So, there is a plan in store, but NYP couldn't tell us what that plan was for, after the 7 weeks, because there was no way that they can hire the new cohort. Did they think we'd jump over? You recruited us and retained us in these positions because of the union, so there's suspicion of union busting. And, there's a lot more to it, and we never really had an explanation. So there is definitely, I feel worried for the women when these 7 providers, aren't there. Maybe NYP is going to pay a lot of overtime and have doctors staff the floor. I'm not sure what the plan is, but NYP just says Columbia is going to make sure it's safe. And I hope we can trust that. I'm not sure why they couldn't work with the experienced midwives they had. That's my point.
All right.
So
OC, go ahead.
yeah, I mean, it brings a very it's kind of scary situation when you think about 7 or 8 7 experienced nurses and midwives that are suddenly not going to be there, and the segment of the population that's going to suffer are the people that need that the most, that can't go and get like a private, nurse station 24 hours or whatever. It's in a population of our district. Minority, is that right? Mainly minority patient. Okay, so I think that it's something that we need to think if this is, hopefully it is, but if it is, what will be a resolution, Steve?
To put our years in context, amongst the 7 of us, we have over 100 years of experience. They're not going to find another cohort like this. They're not.
So my worry is who is suffering from all of this?
The patients.
Yeah, of course, you want your job, but I'm looking at who is suffering, the patients, and where they're from. And
So
who-
something
who
that's
are-
important to know. Oh,
Yeah.
sorry.
No, go
I just
ahead,
wanted
go
to
ahead.
I wanted to mention something that's important to know about the Allen Hospital is that it serves primarily the Medicaid, the patients who go to the Columbia NYP practices who have Medicaid. So if you have private insurance, you go to one practice at Columbia and you deliver at Choney on 165th Street. And if you have Medicaid, you go to the Allen. If you're a low risk, so it is a segregated system from the outset. That is the plan, that is the design. And they are not taking away providers at Choney. They're taking away providers at the Allen.
Are you saying that Medicaid patients do not go to Choney?
They go to Choney if they are high risk. And if they walk into Choney, by law, they have to receive care there. But every low risk Medicaid patient who gets care through our system is directed to deliver at the Allen. Every patient with private insurance who gets care through our system is directed to deliver at Choney.
And why is that?
Morning.
Yeah.
Do we know why is that?
Because of
No, it's always been like that.
been like that. It's look, we have to be honest, and we have to say what it is, right? Like, it's racism. It's the systematic racism to Black and brown women. And the reality is that they, I want to be very clear that Black and brown people as a whole always receive ration care. And I'm going to say that again, ration care. And when you have folks like Allison, Rosalina, Michelle, and the 4 others who really ensure safety, they are ensuring that that ration care does not exist, that every single one of them, every single one of the midwives on this call only want to usher people into the fruitfulness of parenthood and or motherhood. And what is happening is that, and I just want to state this, which I don't know if we stated earlier, the L&D nurses and the postpartum nurses are petrified of 1 to 7 impacted providers are no longer there. They are scared because they don't want to have mothers and babies who are dying on their watch. That's not why people get into nursing, especially L&D. They don't want that. And yet that's what will happen. And that is what NYP is shifting the blame to Columbia and saying, that's going to be Columbia's problem. If Columbia is rationing care, that's Columbia. That's not NYP. And the reality is that's unacceptable. Absolutely unacceptable that they would do that to our communities. Sorry, go ahead, Rosalina. I don't want to over.
Oh, you have nothing to apologize. Nothing at all.
So I just wanted to piggyback on what Alan was saying about this disparity of care that we have had here for decades, is that there's a stark contrast in the physicality of both units. If you see what the labor room looks like at 165th Street, where the women with private insurance, what the rooms look like where they deliver, and what the entire unit looks like when they first come out of the elevator, compared to what this unit looks like, where it's mostly Medicaid or uninsured women who deliver here. It is really, really upsetting if you sit down and think about it, to see the two differences in the labor room and the layouts of the labor room. We have 3 labor rooms that don't even have windows, where we're putting women in to labor in an induction for 3 days like they're walking into a labyrinth. There's absolutely no window.
Yeah. Well, I believe the hospital does have a plan to renovate the labor and delivery rooms at the Allen. In fact, it was a proposal that they floated at the same time that they proposed eliminating the 30 psych beds, which we have opposed. So they have something in mind.
Well,
We've been hearing that for a while.
I've been hearing that I'm going to be here. So I'm going to make, next month, I'm going to make a total of 24 years in total at Presbyterian, and I've been here 10 years at the Allen. I've been hearing that threats of renovation for 9 years, and it hasn't happened. Lawrence Hospital, that was a later acquisition of NYP, where they have nothing but private patients deliver there, no midwifery service. Last year, mid or early last year, which is a new and labor room, they got a $3 or $4 million renovation. And it was a later acquisition of NYP. And the Allen has been here since 1989, 1987,
Sounds
and
right, yeah.
no renovations. And they've been threatening a renovation for years, and it's not happened. Yet Lawrence was renovated last year, a newer labor room.
Yeah.
With half,
And I just
they
wanna
do
add-
half
oh,
the,
sorry.
they do half the deliveries that we
Right.
do.
Right.
And
Well,
I
I tell you,
just want to add
my,
that psych is coming back to the Allen, and
When?
and that has been known in 20. I mean, it's going to be a year from now at this point.
Ridic-
They're claiming
ridic-
2025,
ridiculous.
but that is ridiculous. I agree with you, but I'm just letting you know that, look, you brought up psych. I want to just bring up that this is a community hospital that should have a psych unit, should have a well-staffed obstetrics and midwifery service, and that is not what's happening. It feels like they are taking away more and more services for whatever reason from the Allen. But it's really deeply troubling because I know that they come here and they do a song and dance and they make everything seem really nice. But the reality is that they are profiting, and they don't have any problems profiting off of Black and brown bodies, and then not providing enough service, and that leads to rationing of care to the patients at the Allen.
Let me ask you about the psych beds, which has been a prime issue of ours ever since NISNA came to us several years ago about the plan to eliminate those beds. We have not been told when those beds are going to be restored. And then actually the only thing we've been told is that they're still working on some plan, and which would require renovating the previous psych rooms and maybe converting some of them into single bed units, and therefore they couldn't even tell us when I had a recent meeting with them that whether or not all 30 beds would be restored at the Allen. Have you been told? So you seem to have some other knowledge on this. Have you been told that the beds are going to be restored next year in 2025? Have you been told how many beds will be restored?
I don't know how many beds. I do know that they have said 2025. So that's what I do know as of right now. I really don't want to take away from the midwives. I know. But I do want to say that it does mirror in the sense of where they think care is. So for example, 9 Garden North at Milstein, there is no shortage there for psych, just like there is no shortage for Choney, right? And if you do go to the psych unit at Milstein, it is a very different looking place than what is at the Allen. So I think Rosalina bringing that up around how people, the environment in which people are in to be cared for is very different. We do want to highlight that this is, we're having a very important speak out on Thursday, January 11th at 8 a.m. in front of the Allen, in order to have, politicians speak out against this and to really prevent the closure of this very important service. I don't know if you all know that the Allen Hospital was one of the first hospitals in the country to have a midwifery service in the hospital. This is a historical midwifery service. It is my understanding when they wanted to build Milstein or renovate, whatever they wanted to do with Milstein, they had to have a community hospital, that community hospital had to have obstetrics as well as psych. That obstetrics department that they had when they acquired Allen had a midwifery service. So the fact that
From the
this
very,
is happening
from the very
is-
beginning?
Yes.
The
Yes,
mid-
there was
Yes.
28 midwives at one time in the service. And the
But-
service, when it first started at Baby's Hospital and now at Allen, it's been a total of 58 years.
But when the Allen first opened in the late 80s, it had a midwifery program?
Yes, yes,
Yeah.
there was
Okay.
28 midwives in the service.
Right.
Until the billing scandal.
Okay,
So this is a historical midwifery
Right.
service. It is, it was essentially blazing a path for other hospital midwifery services, and now the hospital, for whatever reason, and whatever reason they have is not good enough. Just let's be clear about that. Is now ending this service, or wants to end it, or intends on ending it, and we intend on fighting it every step of the way.
well, I
And
guess.
I just want to, I want to uplift every single midwife and nurse practitioner, even though they're not here. These are folks who are really scared. They were told during a holiday season that they're not going to have jobs as of February 1st. Every single one of them, I might get emotional, every single one of them has lost sleep, has been deeply, they are really scared, not just for themselves, but for the patients. They each have really, really been deeply impacted personally. On December 4th, when they sent out the email about terminating the service, the nurse practitioner had just had a baby and was coming back on December 5th to this news. It is horrifying how they also sent out this notice that does not acknowledge the number of years of service. It was really disrespectful. They sent this notice out at 6 p.m. at night when nobody would be able to even question or anything. It was done in such a disrespectful manner. And it's really horrifying to me that, what NYP wants to do. And I want to just uplift the bravery and courageousness of the midwives and how they have really centered the patients of the community in spite of, even though they know they're employable, this is deeply impacting their lives. It's still impacting their lives. They are really scared. And we've asked in numerous forums, and when I say numerous, I mean a labor management meeting. We've gone to the holiday party. We brought it up in our local professional practice council. How are you maintaining safety for patients? And in each and every meeting, Krista Kleinschmidt, the CNO, has said the same thing every time, that will be the responsibility of Columbia University, as if we're not dealing with real human beings and real human lives.
Well, and meanwhile, the service is still being provided within the hospital's setting. It's I don't see how you can just shrug your shoulders and say that we have nothing to do with it. And the idea that you're not being provided with any explanation at all. Why all of a sudden is this change necessary? Why are people being let go from their jobs that they've held for years and years and have been doing showing dedication all along? So I can certainly sympathize and understand why you would be upset. Well, I would be upset. I would be pretty damn upset too. Are there
Yeah, I think that it's outrageous that New York Presbyterian is considered themselves the #1 hospital in the country, and that's what they do. That's outrageous.
Yeah.
And I wonder if any of you, or maybe all of you, try to contact the State Department of Health, because the hospital is getting grants and funds and you name it from all sorts of directions. So what did the Department of Health, the State Department of Health, had to say about that? If they answer your call at all?
I don't know if
we're alerting them to what's happening. We are alerting them to the closure of the service.
Michelle has her hand up.
Yeah, and I just wanted to say, I mean, you know, the party line is that Columbia is going to take over the practice. Like I said, the primary concern right now is the timeline, that it would be really impossible to replace these providers. There might have been a way to work with the experienced providers to create a model where you can expand midwifery services. But I think one of the things that's kind of come up is that you know, this was said at a meeting with the nurses when the nurses were asking our new chairperson about why this happened. She said, well, you know, it is against the law to replace non-union workers with, to replace union workers with non-union workers, which is essentially what's going to happen. And in order to do that, we had to eliminate the positions so then we can rehire new positions under Columbia. And I think what I've noticed is all of the advanced practice providers at New York Presbyterian are feeling very worried about what the university and the hospital have in mind, because the union, you know, the recent contract was hard fought, hard won, and you know, it does cost the hospital a good amount of money. I don't think the hospital is in financial straits necessarily, but it's really an attack on the union. And when you know, this letter that you read said that we're being offered other jobs at NYP, and I asked if, you know, next year, will I get a letter in my new position that my job is being eliminated, and, you know, my pension process is going to be disrupted. Is that going to happen next year? And they said, no, we have no guarantees. Yes, that's possible. That could happen. So it's very hard to take another job within NYP and feel that we can trust them you know, because like I said, you know, part of the recruitment was this union, and that's how you got these experienced, skilled, caring providers, dedicated providers.
And are all, well, I shouldn't say all, maybe not, out of all of the 7 of you, how many of you are women and how many are men?
We're all women.
We're all women.
They're all women, all 7. Yeah.
And the majority are women of color.
Okay.
I don't, if this is not a problem, I don't know what is.
One more question I'm a little unclear about. If Columbia OBGYN assumes the service, where would it be provided, at Allen or elsewhere?
At Allen.
It
It'll
would
be
be
at Allen.
So there is a.
All right. So they're arguing that somehow the service would continue, but who knows when that would happen, and
Right.
what type of people would be hired to do it.
Correct. And the other concerning part about that is that, you know, they can go ahead and they can create whatever service they want, but you cannot build a midwifery service without the input of midwives. And they do not have the input of midwives.
All right.
Is anyone on the call today can answer for some of the questions?
Yeah, I'll just have to say on behalf of Columbia that I'm not aware of this. We're speaking, I'm emailing our chair, Dr. Dalton of OBGYN, just to get a sense of the status of this.
All right. Well, Sandra, if you hear back during the course of this meeting or even afterwards, I would appreciate it if you would pass on whatever information you gather. And I hope
Yeah.
I hope you appreciate the seriousness of this situation.
I do, as someone who gave birth at Allen with a midwife, yes.
Oh, is that right? Oh, okay.
You forget, Steve.
Well, I wasn't there.
This was our community hospital. Come on.
Yeah, no, I know. I mean, yeah, yes. I mean, you know, when we,
Hardcore actually by the
yes.
community. I don't think the community gets enough credit for that, but
Yes,
it is the
absolutely,
community
yes.
that created
No,
this.
when
Yeah.
we all worked hard back in the 1980s to create the hospital, it was conceived of as our community hospital. That was the phrase that we were using time and time again. And frankly, we never quite thought of it in the same terms as the main hospital at 168th Street. I think we did think of it as being not not less of a hospital, but somehow geared to more of a community practice than being a major institution. So I don't know that we thought of it everything at the Allen being looking as the same as what's offered down at 168th Street, but certainly it should all be high quality, and the community certainly deserves a high quality, and it deserves a consistent level of service.
So one of the things that I always say is because the hospital was forced to build the Allen because of Milstein, is that they were forced to build the Allen. They didn't want to build the Allen, and it shows. I always say that.
Well, I don't know if I agree entirely, but it was certainly an outcome of an extended discussion with the state health department about the Milstein and other expansion programs at the main campus. All right, is anyone else?
No, I just wanted to say, thank you for for the great quality of care that you're providing. I'm concerned that your positions are being eliminated. The only thought that I have, would a letter of concern from the community board to Columbia Presbyterian be worth writing?
Well, it would be a resolution.
Because I don't know what's going on. I have
Yeah.
no clue.
No, it would be a resolution which we would pass, and we would then present it to our full board in another couple of weeks. And considering the fact that this deadline has now been pushed off to March, I guess we maybe have a little more time. I was concerned that this, if we met at the end of January and passed a resolution, by the time we put it in the mail, it might be a fait accompli. But now maybe there's a little bit of time in which a position taken by the board would be given at least some, I would hope would be given some consideration.
So we will plan on trying on passing a resolution next month, or we
Well,
pass.
we would have to do it this month.
Oh,
I
as
don't-
it's like today.
Well, yeah, I don't think you want to lose another month.
No, I'm all for it. I agree with you.
Yeah.
I second the.
Steve, I have two questions.
Oh, yeah, go ahead, Elvin.
Hello, how you doing? I just have two quick questions, just to verify. This is the elimination of all the midwives at the NYPD Allen Hospital, just to verify, that's everyone in the position?
The current ones, yes.
Okay, perfect. And then the second
Yeah.
question, I'm not sure if Michelle, if you mentioned it, or correct me if I'm wrong, did someone indicate that the jobs were already posted at Columbia?
Yes, they posted the job.
Okay. Okay, thank you.
Well, and let me ask, assuming that you're, I'm sorry, these are going to be non-union positions, is that?
Correct.
That is
I
correct.
mean, we have one midwife who's 8 months away from being vested, one midwife who's 13 months away from being vested, one midwife who's 22 months away from being vested.
Yeah.
So you wonder if, there's something else going on.
Yeah. Well, Nick and Claudia, do you have the option of being able to organize these midwives and then bring them into the union?
I mean,
But we
that's
have the option to organize them, but again, that does not speak to the patient safety piece that we've been elevating in the meeting. Again, that this would be all new folks who no one knows who they're going to be. And so, yeah, we could always bring them into, that's not the issue.
No, I know, I understand that, but
Patient safety.
I don't like the idea of they're trying to do this as as an end run to eliminate, union positions.
That
I
is
mean,
correct. That's a huge concern from
Right.
from other advanced practitioners in NYP.
Right.
So just to give a little bit of context, this is, we had one I was not here at the time, but in 2020, there was an NP who went from NYP to Columbia last year. They had 3 Payne NPs who this also happened to. And now this year they want to do it to 7 folks. And so, we have kind of been like, no, this cannot happen. It will impact the community greatly. And also it does feel like there's a pattern of having advanced practitioners not be union. And we want to make sure that stops immediately.
Right. Well, I think we would all agree with you on that. All right, so, OC, did you want to make a motion?
Yes. I move to pass a resolution? No, I move to
Yes, yes.
to pass a resolution
That
in
says,
support
yes,
in support
right,
of the let me think about how I'm gonna put it. In support of is reinstitute the positions is the right term?
Yeah.
Reinstitute the position of,
well, at this point, they haven't actually been eliminated, so I would say to retain
no,
the,
they were
position.
told there are
yeah, but it's still on until March 3rd, so it's to retain the positions.
to retain
Right.
the position of all nurses
Right.
that receive letter of elimination.
Yeah, yes,
I don't want to have a number because tomorrow morning then end up with 2 more that are
No,
going to
no,
be eliminated.
no, they only have 7.
Okay. 7.
Okay, is there a second?
Second.
Carmen seconds. Any further discussion? All those in support indicate by raising your hands. That would be, 7. Therefore, no one is left to oppose or to abstain. And fellow board members are allowed to vote in this case. So that would include, maybe only Hannah. Hannah, do you wish to vote on this resolution? Maybe you stepped away. All right, very good. So, Claudia, Nick, I'm gonna be in touch with you further.
Oh, hi, I'm so sorry. I was on mute and I couldn't figure out how to unmute myself. Yes, I vote yes.
Okay, very good. Thank you, Hannah. Are there any other board members that, on this call? I don't see any others. Okay, very good. All right, so Nick and Claudia, I'll be in touch with you, to make sure that I have, the information, accurately.
And we should add it should be, retained with the same benefits.
Well, no, they're gonna, well, yes.
Well,
They-
yes,
if they-
yes.
No,
but-
if they keep their jobs, yes. All right, but my suggestion also would be that you consider also coming to the general board meeting on Tuesday, January 23rd, and sign up, have some, have either Rosalina, Michelle, Allison, or give somebody else a chance to speak to the board, and just to reaffirm your position.
Definitely. We will have more information by then as well.
Oh, okay. All right. Well, please say.
Steve,
Who
it's
is it?
Hannah. Steve, it's Hannah. I just want to say something that although I did not give birth at Columbia or at Allen, but I have 5 children and all of them have been born on Medicaid. I've always had the insurance that you get when you're absolutely have no other option. So I personally have felt the difference of availability of good care when you have this insurance, and when you find good care, to lose that is such a tragedy because it's so hard to get good care on this minimal insurance that you get from the city and state. It's very hard to find providers that are willing to work for, what they get paid for this, for this insurance. So when there's these brave and generous women that are working and, at the Allen Hospital and help and sincerely helping women, this is something that should be protected.
Well, thank you. And I think, I think this is one of the reasons why we worked hard in the past to support the creation of the Allen Hospital. So it would provide a high level of service to people in our community. So we would certainly want to see that continue.
And another thing I'd like to say is that I live here in Washington Heights. Most of my neighbors are Dominican, and many of them don't speak English. And I actually, thanks to them, have learned quite a bit of Spanish to communicate. And I have to say, it would be, I think, another travesty for new staff to come in that is not, culturally sensitive or able to communicate well with these mothers who, and labor is no fun for many women. It's not easy. And at that moment, it's so important to have someone you can connect with, who who you can trust and feel comfortable with. Like, it's one of the most vulnerable moments of your life. So I don't know a lot of people that, can say, oh, labor, oh, yes, I missed that. It's a very difficult, time that you really need support that you can count on and that you have a rapport with. So I think that, the fact that, I think these women are, by removing them from their positions, it's like ripping out a piece of the community. It's like, I don't know. It's like, with the flesh, like, just horrible. It's not right. It's completely not right.
All right. Well,
Luckily, we are in New
Yeah.
York State.
yeah. Well, all right. Well, I think we can all relate to what you've just said, although not quite as dramatically. So thank you, Hannah.
Yes, thank you.
And Hannah, Nicholas is reaching out to you in the chat. All right. Well, thank you. Appreciate once again New York State Nurses Association coming before us and keeping us abreast of issues at New York Presbyterian. And then Nick, you're also saying that you're going to check up on the psych beds issue and get back to me on that as well. All right, because you've made us very much aware of that issue, and we've we've been working with you closely on it, and we've taken a strong position, and as I think you know. So we certainly want to see those beds restored sooner rather than later.
Well, thank you so much. Community Board 12 has always been so supportive of NISNA and our membership. Greatly appreciate it, Steve.
All right. Okay. Take care. Talk to you soon.
Take care, everyone.
All right. Next on the agenda.
I'm just writing
I'm
down
sorry?
people's emails. So I'm just taking down people's emails. They put them in the chat, so I'll be here for 1 minute more, just taking down the emails.
You can stay as long as you'd like.
Yeah.
I just wanted to say, thank you for listening and thank you for your time. I got to get back to the floor now.
Okay, well,
Thank
good.
you for your support.
Thank you.
but
Thank you so much
that-
for supporting us. Thank you.
Thank you for all of your work over how many years did you say? 24? No.
Well, my career has been really long, but at total at NYP has been 24 and 10 here at the Allen.
Right. Well, thank you for all that you've done over all those years.
Have a good night.
All right, same to you.
Thank you.
Okay, next on the agenda is our borough liaison for the Department of Health and Mental Hygiene, Pauline Ferranti. But before I let her speak, I have to give my usual report on the latest statistics on COVID-19, which I've gleaned from her own department's website. So I'm sure she doesn't mind in the least. So the hospitalization rates for two of our zip codes, 32 and 33, were fairly high in the 28-day period ending December 21st. In the zip code 33, the rate was 33.3 per 100,000, which put it at the 25th rank among the city's 177 zip codes. Zip code 33 had a rate of 30.8, which gave it a rank of 32. Zip code 40 had a hospitalization rate of 25, gave it a rank of 56, which is, still puts it in the top third of all of our zip codes. And zip code 34 did the best at 16.6, and the rank was 116. Since we last met on December the 7th, there have been 880 additional cases in Washington Heights and Inwood. So we now have close to, since the beginning of the pandemic, 70,769 cases. The only bright note in this report is that there have been no additional deaths since we last met. And I think that may be the first time I've ever given one of these reports, and we haven't had any additional deaths in that period, in the intervening time. So let me ask you, I meant to ask you this a month ago, Pauline, when we talk about all of these cases, and close to 71,000 cases in Washington Heights and Inwood, this could involve, this isn't the number of individuals. Some individuals have gotten COVID more than once, maybe more than twice. So each time they get COVID, I'm assuming that's a separate case. Is that correct?
I am not sure. I'm assuming so, but I will check with our data team just to confirm.
All right, because the website does say something like, one out of every two residents of Washington Heights and Inwood has contracted COVID. So maybe each case is a separate individual. But yeah, I would appreciate it if you could check on that.
Yes, I will definitely check on that.
Okay, so okay, can I let Pauline give her report?
Okay, and then I'm gonna ask
Yeah,
my
okay, very
question.
good. All right, so Pauline, I asked you to give us an update on COVID, on the flu, on RSV. According to today's paper, the most recent data from the Centers for Disease Control and Prevention, that New York City reached the very high level of respiratory illness, the highest level on CDC's scale. And as I also mentioned to you, the health and hospital system has now has reinstituted its mandate for people wearing masks entering both the hospitals, community health centers, and its nursing homes. So I asked you to check on whether or not this is going to suggest that there'll be mask mandates instituted more widespread.
Right. Yeah. So we are seeing respiratory illness. There are high levels across the city and, nationwide as well. So we have been encouraging people, of course, to get vaccinated, not only the COVID vaccination, but the flu shot as well. And then also just making sure that if you have young children in particular, or older family members for RSV. So I know that there have been some issues in sort of accessing vaccines, and that sort of is it's out of the NYC DOHMH, agency's control, but we have been trying to share information with folks on, where they can get vaccines. Of course, your healthcare professional is always your first stop, but the vaccine finder is still online. It's still functioning. So we encourage people to go there as well. But of course, we understand that it is very frustrating to not be able to get a vaccine if you're looking for it. So if you are hearing of any cases like that, please let me know, so I can reach out to our immunization team just to see how they can be helpful. I did ask about the mask mandates. And so at this time, the agency itself, so only speaking on behalf of DOHMH, not the city, but the agency right now is not currently talking about reinstituting mask mandates, but we are continuing to monitor. you know, in terms of H&H and other clinical facilities, it just makes a little bit more sense since most of their foot traffic are for those who are already sick or have compromised immune systems. But of course, we have always encouraged people whenever you're out and about on public transportation or, you know, around crowded areas to continue wearing your mask. So I don't think that messaging has changed, but I think a lot of that information sort of has gone to the wayside, or people just had, you know, I think people are a little bit, they've moved beyond that. But it is encouraging for me to see at least that every time I'm on the subway, I do see folks wearing masks. So that's nice to see, but we can always encourage, you know, more mask usage, especially on public transportation or crowded areas.
And do you have anything more to add now on RSV or the flu?
Nothing new or major. So if there are any specific questions, I'm happy to bring them back to the agency and provide answers to them.
All right. Well, my boss's wife is now laid up with RSV.
Oh,
Is there
no.
anything? Yeah. So RSV is definitely going around. Do you know whether the federal government is still providing free COVID tests?
So I did hear about that. I don't have any specific details on it, but I'm happy to check with our team. I don't, I heard that there was like a new round of tests
Yeah,
being,
yeah, yeah. But I'm wondering whether that period may now have expired. Yeah, if you learn anything about it, please pass it on.
I will definitely.
Okay, OC, you had a question?
I'm spacing on the question. So Nick, yes. 71,000, roughly 71,000 cases. And did we say that that's actually 71,000 individuals?
No, well, that's what she'll check on.
Yeah, I'm not sure.
Okay. Because if it's individuals, that's a lot.
Right.
Well, it could be individuals because the website also says that 1 out of every 2 residents of Washington Heights and Inwood has contracted COVID.
Okay, so that means that almost, no, a third, roughly.
No. It's at one point it was 1 out of 3, and I think the website has now been is now saying 1 out of every 2.
So well, our district has roughly 220,000 residents.
Yeah.
So 71 would be a third-ish.
Right.
So, but in any event, even if it's a third, that's a lot.
Yeah, well, it is a lot. Well, yeah, I mean, yeah, absolutely, it's a lot. Yeah.
So
that's what I've been trying to emphasize every month.
So the question, like what you said before about the vaccinations, I'm just thinking, I feel that we should bring back the testing vans or locations to our district. Obviously, vaccination locations. Is there a way to bring those back because of the high rate of cases? Let me ask you this. What need to alarm Department of Health to do something to try to contain the number of cases in a given area?
That's a good question, OC. I'm not sure. Let me circle back with our H&H partners because they were the ones who were able to sort of deploy a lot of those in community resources like vans and things like that. I'm not sure whether or not COVID is still considered an emergency at this point. And so I don't know whether or not those resources are still readily available. But I do understand your point, seeing that there are increased cases. And of course, also not everyone is reporting, right? And so, or not everyone's getting tested.
Yes.
And cases might be even higher. And so, I mean, I definitely understand that concern. Let me reach out to the folks here at the agency first thing tomorrow, just to see what potentially can be done, given these increased rates, and what resources can be made available to folks.
By the
Because
way, if it
Little pen-
helps, oh, I'm sorry.
I'm
If
just
it-
saying that for me, it seems like our district has a little pandemic going on.
Right, like a mini pandemic happening.
So, yeah, come back to us next month.
I'll come back sooner rather than later. I'll touch base with Steve directly, and then hopefully maybe by the next meeting there would be like more information. But as soon as I find out anything in terms of providing sort of in-community resources, I will let Steve know.
All right, thank you.
Thank you.
Ryan, do you have a question?
Yes, sir. My whole thing is about the COVID testing. Why are we having a made in China COVID test today? And B, why are we not transitioning to making, say, an N95 mask from the Chinese made product? Why are we not generating the COVID products, the mask and other stuff as American made products? Why are you required to take a COVID-19 test or required to go into a building last year, January 31st? COVID test or
Well, I think, Ryan, I think that's a question that goes way beyond, our ability to answer tonight, but,
I'm just saying, you basically want to volunteer, and then that volunteer will participate in the idea of reading coding.
No,
It's a COVID.
well, I believe our national government is actually, making an effort to provide that ability to have local national U.S. industries create the masks and then the vaccines.
It's about respecting the people. You're using a COVID-19 test made in China. You're not respecting the people's ability to test their body to test and say, hey, I don't have it. You're not making American products that be responsible to China's problem. Why would we use a COVID-19 year to Chinese made product to test our people? It's not respectful of the American people. We need to respect ourselves as people and respect what this was that we do for the party.
All right, well, I think,
I think it's the federal government that is overseeing all of that, so,
I agree, but it affects the community though.
yeah.
right, but
Okay.
it's nothing we can do as,
Okay, well, Ryan, I think we understand the point. You've made the point. Diane, you have your hand raised?
Yeah, I just wanted to say, if you go to covid.gov, it says they're still offering free tests. It
thank you.
sounds like they posted it at the end of November, so if somebody's already ordered, they may have used up their allocation, but it looks like 4 free tests per household. So I don't want to step on Pauline's territory, but I did order them not that long ago, which is why
No, that was a good, Pauline doesn't object at all.
No, I do not object at all. And actually, I just found the link that you can order the no, sorry, I wrote masks. I meant tests, not masks. You can order them on the USPS website.
Right. And you can also get, looks like also covid.gov, but they came like really fast. I got them not long ago.
Okay, very good. Thank you.
You're welcome.
So, Pauline, you can order them through the United States Postal Service.
Yeah, they're in charge, I think, of sort of getting all of those shipped out to folks.
Yeah, they're doing the fulfillment.
Oh, well, okay. That's interesting. Okay. All right. Any other questions for Pauline? All right. Very good. All right. Thank you, Pauline.
Thank you.
All right.
Happy
Next
New
up.
Year.
Oh, yes. Happy New Year. Yeah, we should have started off the meeting with a Happy New Year. Next up is Sandra Harris, Associate Vice President for Government and Community Affairs at the Columbia University Irving Medical Center.
Hi, Steve. Hi, everyone. Happy New Year. So I'm actually still not back at work. So Steve just made me show up at this meeting. So I did want to jump in because I wanted to share about a new initiative that we did this year for the holidays, which is the science programs in our local schools. And what we did is reach out to our local science teachers, understanding the horrible budget cuts that our schools and many of our other nonprofits fire, police, and all of them are experiencing. So we had a conversation with science teachers and in trying to get a sense of what were their needs in the classroom. As you know, each year we do a holiday toy drive. So we decided that in addition to our toy drive, we wanted to reach out to our science teachers and students and see what were those needs in the schools, and then in turn do a fundraising event internally. And it turns out that we were able to support 4 local schools in several of their science initiatives. One of them being I call it my alma mater, PS 132 Juan Pablo Duarte, which is started a beautiful hydroponics, I couldn't even say the word, initiative, which is helping children, following the pandemic. The school realized that the rates of obesity skyrocketed and that they needed a way to educate parents and students in terms of how to healthy eating greens. So they started a hydroponics labs within the schools. As a result of this, a lot of them have been growing their own food, coming home, talking to parents about this. So when we asked, one of the challenges that they had was making sure that each of the students participating in the classrooms would be able to take one of these equipments home to do the growing at home. So I'll send you the link to the video. So we put a very interesting video together with the kids, the students, the teachers, and some of the parents, and began our internal fundraising. And we have successfully fundraised for the entire class to have hydroponics equipment to bring home for the semester. So overall, we work with PS 132, KIPP High School, PS 173. For KIPP High School, one of the needs that was identified was the children with special needs. Apparently, within the classroom environment, their sensitivity to noise really limits their ability to focus and do the work. So that drive focused on purchasing the special headsets, basically noise counseling headsets for the students in the classrooms. And I think overall, we're going to continue to have these discussions throughout. The response internally was overwhelmingly from December 1st to December 21st, we were able to secure $30,000 to support 4 initiatives within the schools that we have identified. And we definitely want to continue to work with the local schools and their science programs to identify some of those needs. So just really wanted to share that, because the teachers were very, very excited, but I think the students most of all really appreciated the support in the classrooms and so on. I think that other news that I want to share briefly is that we're coming up with our Dyckman Scholar students once again. So we should be making the announcement sometime in the next few weeks as to who the new students will be from our community. And I think that's about it. I think I'll share briefly on the toy drive. As we do every year, we were able to fundraise and distribute toys through to this year. We did 12 local daycare centers and some of the elementary schools in our districts, along with the 33rd precinct as well, in terms of toy distribution. So that's my end of year. I mean, I'll be getting back to work on Monday, so I'm sure I'm gonna, and you guys have already given me some tasks to bring back to our OBGYN.
Right, well, stop goofing off. Which was the school where the kids have sensitivity to noise?
That's the KIPP school. So so there is their special needs classroom.
Okay. So it's not because of like a subway line outdoors or outside the school building, or?
No, this is in terms of the way they explain is their ability to focus and put something.
Right.
And it's interesting. We've learned so much about the technologies that they have. Unfortunately, the district, as we were saying, our schools sometimes are shortchanged and they don't get the resources to support these initiatives fully. So one of the things that we're also working is also with the parent coordinators to help us identify, because our effort, we're dedicating a full year to just supporting the sciences in our local high school. So we're going to be coming back to you with that in some of our pathway programs as well.
And you said that they're growing food in the classroom?
I know they are. I never learned. I don't know if you guys have heard of this hydroponics.
Yes, of
What-
course.
You have.
Yeah. Well, what kind of food are they growing?
Well, they grow greens. It's just amazing. They're growing, foods to bring back home and educate their parents. I mean, I was just shocked to see how much the kids knew about this, and the equipment is very sophisticated. I'll send you the link, Steve. It's very, very sophisticated. I'm really very proud of this work, and I hope that we're able to do this for every single classroom that goes through this program.
Are any of them growing one of these really big beanstalks?
For Jack and the Beanstalk? I don't think so. But I think the important thing, Steve, and you'll see it in the video and what the teachers talk about, is that connection with food and growing and bringing that education home to the parents.
Yeah, okay.
It's like bringing their scientific experiment into the home, but then learning about the market, learning about, healthy recipes. So one of the things that we're doing is also connecting our Institute for Human Nutrition to this initiative in support of this. So it's really, if you see the classroom, it looks like a real laboratory.
All right, very good. Where is the
This
kid?
is elementary school. This is PS 132. Juan
Yeah,
Pablo
it's not, that's not the hydroponics is not happening in all 4 of those schools? It's only
this is at an elementary school.
Yeah, okay, all right.
Yeah.
And where is the KIPP High School?
KIPP is part of the within the school over at the Mirabal, over by 165th.
65th and St.
I'll send you the list of all of them so you can take a look.
Is it at the old Stitt Junior High School?
Which state junior high school?
Stitt Junior High.
Stitt. No, that's my Stitt. Yeah, no, I'm sorry. Let me stop because I also went to Stitt. No, it's not at Stitt.
It's not at Stitt, okay.
No, it's where the precinct used to be.
Yeah.
That's Gregorio Luperon.
No, Steve. Gregorio Luperon is not the precinct.
Jamel and 165th.
At
165th, right where
But the Mirabal sisters.
Yes, it is within the Mirabal sisters. That's what it's
I'm sorry.
Yeah, and Luperon it's on 166.
Yeah, no, that's right.
Next to the post office.
Yeah, that's right.
And it's a high school also. Yeah.
Yeah. KIPP is within the Mirabal Sisters School building. Okay, very good. Okay,
So
thank you.
I'll send that over, and hopefully we'll be coming around to talk about this and other pathway programs initiatives.
All right, very good.
And I'll follow up on that other situation and get back.
Really, would appreciate you getting back to me as soon as possible, because that may help inform the resolution that we write on this question.
Okay. Did they? I got to the conversation a little late, but did they share? I heard they shared a letter with you that they.
Yeah. But I can forward the letter to you. But the letter basically says nothing. Gives no explanation as to why these positions are being eliminated, and doesn't really speak to doesn't say anything about Columbia running the.
Okay, that's what I wanted to make sure, because it seemed that it said that Columbia was taking over the practice.
Yeah, no, but that's not in this particular letter.
Okay, just wanted to make sure.
But evidently that became known in further conversations that they had.
Correct.
But,
That's what was said, Sandra. That's what was said in the meetings to us numerous times, is that it's going to Columbia.
Right.
And that is what the CNO of Allen, Krista Kleinschmidt, has said. That is what the VP of NYP, Stacey Williams, has said. So that is what's being stated to us.
But nothing in invite. Yeah, right. Because it would have to be stating that it was going to Columbia doctors. But I will follow up on that. I just sent an email to our chair.
All right. But please let us know as soon as you can.
Mm-hmm.
All right, Hannah, you have a question? Hannah?
Is that an
Yes,
old
yes,
man?
I'm here. I'm right here. I was just curious, where is the school that has the sound sensitivity to the classroom?
That's the KIPP High School at I guess between 167th and 170th Streets along along the Edgecombe Avenue, between Jamel Place and Edgecombe.
Mhm.
Is that in Community Board 12?
Yes.
All of them are in Community Board 12. Mhm.
And how are they requesting to address the sensitivity of the sound?
Well, it's a special needs classroom, so this is something a need that the teachers identify, something that they have been working on.
Do they have a suggested solution, or they're just asking for attention to the matter?
No. They have a solution. We were just getting the initiative that we conducted was to get them the headsets that they needed. They do.
Okay. I have two adult children who grew up in the District 75 with special needs schools, and they both wore the headsets. I can't say that they're always effective, but
Okay.
if these teachers actually tried the headsets and saw that they were effective, wouldn't District 75 supply them? Is this a private school or is this a public school?
No, this is a public school. I mean,
Yeah.
one of the things, yeah.
And District 75 is not supplying the equipment?
I don't know. I mean, I don't want to put the district in a bind, but these were the needs identified in the classrooms. And as you well stated, it does appear to be very helpful to the students. And we all know of the needs in our district, especially within our special needs classroom. That's a whole nother matter. Yeah.
Would they need us to reach out to District 75 to make sure they get supplies that they're supposed to be receiving?
I mean, I can definitely reach out to them and see if they would like something like that. But
Or are they asking for help to get a sponsor? To get it
no.
privately?
I was just reporting that we were the sponsor and we provided the
Oh,
heads.
you were Oh, okay, excellent. I'm
Yes.
so glad to hear that. Thank you.
Yes.
That's amazing.
And thank you
Okay.
so much for the feedback. So I'm glad that you're aware of the headsets and how valuable
Yes.
they are.
I'll let you know also, if you visit the aquarium, the New York Aquarium in Brooklyn, the staff there is trained to recognize special needs individuals. And as I have two adult children with special needs, they noticed me with my daughter. She, certain rooms she could go into, certain outside areas she could, and then she would stop because the sound of the ocean was really bothering her. And a staff member came with a special bag that's provided by the aquarium. They give it to you and then you return it to them on your way out. It has headsets, it has fidget toys, and different sensory things to accommodate to the special needs individual. So those headsets, it's a very known helpful item that even the New York Aquarium started to supply to the public.
Wonderful.
All
Thank
right.
you so much, Hannah. You're a wealth of information. I'll share that back with the teacher.
Thank you. I
Yeah.
apologize. I apologize if I get a little emotional, but my grandfather was an opera singer. Both my parents are sculptors, so we're very theatrical. So forgive me if
Thank you.
my voice gets a little my manner is not polished. I apologize for that.
Well, no apologies. Thank you so much. It's very comforting to hear you. Yeah.
Okay, thank you so much.
Osi?
Yeah, Sandra, I don't know if you know that, but I'm thinking about maybe we have special need kids or maybe adults that live with that kind of conditions, similar condition, that live right next to the number one train. And how are they being, how are they being, if there is any, how they're being like, I don't know if there is like specialist that dealing with that, because the train is like 24/7. And
I think a lot of it in our, so what we did for this initiative is sat down, talk with the teachers, talk with some of the parents. I think, as Hannah said, a lot of this is our parents not being aware of the resources.
Right.
That are available for free, and they can follow up and really say, I'm living in a certain area and this is what's happening. So there's a lot of work that's needed around that and advocacy with parent coordinators. And bringing that information to the forum. And that's one of the things that the teachers said, that even having the sets at the school is great, but it would also be great for the parents to be able to have these sets at home, right? As a way also to help them. But again, it all goes back to that need and re-educating and talking to the parents, and also really facilitating the resources and connections, because it's, as you may know, it takes more than one call, one meeting, one intervention to finally connect the parents to the right services. So, you know.
Well, Sandra, thanks for reporting on this. I just have a quick follow-up, and I'm sorry if you may have already mentioned this. Did you guys partner with all the schools in the district or just specifics? Like, how did you guys go about partnering with the schools?
So as you know, my logo is connections. So we reach out to schools that we already work with in terms of we made sure to have elementary and middle schools, because we have a separate initiative for the high schools. We started this as a holiday drive because we realizing that we also have a lot of children with our migrant crisis that may not necessarily, have toys to bring home. So we wanted to add a way of supporting teachers with additional supplies, understanding the additional needs that they're now facing. So we started working with schools surrounding our medical center campus and realized that the need is great. So they have called other schools. So we're going to make this a year-round event and continue to reach out to the school, which, by the way, is very challenging, relationships until you get to the right teachers. Because what we're trying to do is not just go to the principal and have a conversation. We want to talk to the science teachers. We want to learn from the students what's needed and then figure out how we can support them around that. But we are going to make it a year-long initiative. So far, we have 4 schools, which we did all during the month of December. And coming in January, we'll continue our outreach to our other schools.
That would be really wonderful, just to add on to OC's point. And as you mentioned, there may be so many students that have a need and don't have the access, and they're just like not aware that these resources are there. So if outreach is possible, that'd be really wonderful. And
we're going to continue to do that, and I'll be coming back and updating and putting on our website. And I think that also when we look as a medical center, as a teaching institution at, health sciences careers, is that we need to start early exposing our children to health sciences, but also if the classrooms are not supported in the right way with the right tools. I mean, one of the projects also that we're sponsoring, believe it or not, is providing supplies for their science fair. I mean, I remember a science fair, and remember you had a poster. And how many posters do you go through before you get your actual project going? Well, parents were saying, getting 1 or 2, we're talking $8, $7. And the teacher said we do get supplies, but they run out because there's a lot of testing in the process. So simple things like materials to participate in a science fair. So are we making sure that we want to support the classrooms also to provide the sciences education as well, and have it, be a fun experience for the students?
Thank you so much for that. I also just want to mention, I'm part of the Youth and Education Committee as well on the community board, and would love to have you maybe share some of these initiatives so that we can connect you to some of the schools. So maybe I'll get your information.
Yes, we reach out to Faye. We reach out to Faye and kind of give her a lesson. So
share now.
Yes. So it's nice
we would
to
love
meet
to
you.
have
She did
you.
share. She did share. But definitely it's something that we want to bring to them. So I will be reaching out.
Thank you so much, Sandra.
Very good idea.
Right, but it's beyond just the classroom. What I was referring when I said the number 1 train and then 24/7 noise is that maybe the Columbia can do like a study and post it in each individual building saying, hey, we're doing X, and recruit kids and parents to that study, those that live right there on the number 1 train. Because
you're saying to study the impact of noise. I mean, I think we have some of those studies. I can check.
There was a study that was done years ago
We do
uh,
have those, I
with,
recall that.
concerning, PS 98. And,
Mhm.
and it was a groundbreaking study by one of the city's, probably the city's preeminent specialist on noise issues, Dr. Arlene Bronzap. And what she found was that classrooms on the side of the school building, right alongside the subway tracks, kids in those classrooms were not doing as well as the kids on the other side, which who didn't have to deal with the noise all day long. So she ended up forcing the transit authority to modify the tracks in order to eliminate the noise issue right
I
next to
think the
this.
tracks, but there was also some recommendations for the schools in terms of the windows
Oh, maybe, yeah,
and how
probably.
that sound,
Okay.
yeah. So there is
Well,
something already, Ozzy is looking it up, but there's a requirement. I know there
Yeah.
is one when you're doing construction that
Yeah.
you have to provide the school with soundproof shield for the windows, because that's where the noise or something gets through.
Yeah.
Depending on
Right,
the
but
windows.
you're talking about schools, I'm talking about where kids lives and go to sleep. And so
Yeah,
that's
yeah,
in a-
that, yeah.
sleepless nights, and we know of the effect of that, but it would be nice to have Columbia maybe doing study and recruit those.
I will bring that back, and then maybe that could be part of a CVPR, a community-based participatory research initiative.
Right, yeah,
Ozzy, you can lead it as the PI.
right.
I find the
Right.
faculty lead it.
Right, yeah, but somebody should be maybe doing study on that, Bert. Yeah, that's it, yeah.
If
All
I
right, very
may,
good.
if I may, Steve, if I may ask a question,
Yeah, go
does
ahead.
does the board participate in any public posters or like how to get information to the local public? Like, do we have any ties with, they have those poster boards outside of the bodegas or anywhere where we could put advertisements, with this information for the public?
Well, I mean, if you're referring to the, what is it, the NYC Link kiosks, I believe
You do.
I
Yeah.
believe we do.
Nine does, yeah.
I believe we do have access to them. I don't know whether or not we ever take advantage of it, but other community boards certainly do. But I
think it
suspect
would
that.
be-
Nine uses them frequently. We're actually doing a health fair with them, and this is where the whole advertising and resource connection has been taking place. Through the link.
I think if it would be possible, even on the kiosks or even paper posters, to do a bilingual poster so that all the families can, read it and notice it, to say that if you have a person, a child, an adult in your life with special needs, there are, these resources, and come to us, we'll help you know where to go and, how to get them. Or like have a website set up, or maybe a link on the site or something where they can, find out how to get these services that they need.
Well, I think this is something we can certainly explore, certainly with your expertise and your help.
It's not location based, no.
All right, so let's, Sandra, thank you for your report, and we'll look forward to your getting us information about this issue with the midwives and the OBGYN departments at Columbia. Next, Julio Batista from New York Presbyterian.
Yeah, hi, Steve. Happy New Year, everyone.
Is that a respiratory illness?
I'm sorry?
Sounds like you may have a respiratory illness.
Yeah, no,
RSV.
I've had a cold appears to be a cold for about 2.5 weeks now.
Oh, God.
Anyway, just to let you know, in terms of the COVID tests that were available, as you may know, the federal emergency is over and done with, according to them. There is no additional funding. However, they do have a stockpile of tests in warehouses, and that's what they're right now trying to distribute. So if anyone, needs to test, they should contact, go through their the United States Postal Service website and order them, because when they're gone, they're gone. They're not going to be replenished. So just want to add that. In terms of the COVID numbers, which is something that I know the community asked, system-wide, meaning all 10 of the hospitals in New York Presbyterian. There's a total of 336 cases. Uptown, there is 93 cases that are broken down to 23 at the Allen Hospital, 63 at the Milstein, and 7 at the Morgan Stanley Children's Hospital. Wanted to add that due to the increased numbers, the hospital has elevated masking. So we're now recommending that all staff mask up, especially those.
Are you recommending it or are you requiring it?
We're recommending, not we are especially those in the patient care areas, but it's something that we're recommending, not requiring.
Okay.
And also just want to say, in terms of the COVID, is that due to the increased numbers, we usually do a Three Kings event at the Morgan Stanley Children's Hospital. We're now have canceled that. We are, however, providing the 600 toys to the community, especially to El Nido La Esperanza, which is on Broadway 174th, and also to the Mexican Coalition that will be distributed to many of the kids of asylum seekers. So we want to make sure that those toys are still given to some of the kids who are in need in our community. I just also just want to give a final thanks really to Steve and of course Parks Department. We did have our Duarte Square lighting ceremony on December 7th. These are very difficult times. We want to make sure that we were inclusive. So for the first time, we did include a menorah. Again, thanks to Steve, who allowed us to really be able to submit the application and get that approved by Parks. And of course, also the 33rd Precinct through Maria Luna and Jana Lasord, who works now at Parks Department, oversees parks up here in Washington Heights. So thanks to them really for making that event a success. We had a great turnout of community members there at the event. So in terms of, I did send to Steve a little note on the issue with the midwife program at the Allen. Reiterated there that as mentioned that it's not being eliminated. It is being transferred to Columbia. Services are not gonna diminish. They actually will be greatly improved. And all I want to say is really in terms of the employees, they mentioned, they reported that the job is posted, that it's open to anyone who wants to apply. So, but I'm going to leave it at that in terms of that particular issue.
But how is it that the service is being would be greatly improved?
Because the midwives are now going to actually be able to help deliver, be able to deliver babies themselves. But again, and it's when we talk about continuum of care, I mean, it's very important. And so that's one aspect as well. But again, I'm not going to get into sort of a debate here in terms of, who's right, who's wrong. But again, we care a lot about our patients. I know that you mentioned, Steve, about that prenatal area and delivery being upgraded and renovated. That has been a hold because of all the issues with what was happening with the psych unit. We know now what's going on with psych unit, and so delivery and labor and delivery areas will be renovated going forward. So,
well, do we know what's happening with the psych unit?
Well, this is the first I heard that they're looking at 2025. I would I'm gonna go back and find out. I'm gonna go back and find out exactly what's the time frame, including the sort of construction of that space.
But I tell you I mean, among other things, what concerns me about this situation with the nurse midwives is that, I don't feel as though the hospital has done, anything approximating an adequate job in explaining why, it's necessary to eliminate those positions. And, especially when you have people who have been serving, so many years and obviously, and apparently doing a very good job. Why is the hospital, I don't want to put you on the spot, but, and you may not know the answer, but I don't think it's, this is a satisfactory, the hospital has taken a satisfactory position and is just, apparently willy-nilly, eliminating, people's jobs without providing any kind of explanation, whatsoever. I just don't think I don't think this is appropriate, and apart from the fact that, it does, if you're talking about continuity of care, doesn't look as though there's going to be a continuity of care if these people are going to lose their jobs as of March 3rd, and these new positions are only being advertised right now. It's hard to imagine that something will be in place to quickly fill a vacuum, and it remains to be seen whether or not the people replacing them are going to have anything approximating the experience of the people who are losing their jobs.
And eliminating women's job, we're talking about.
Yeah.
Okay. No, it's important.
Yeah. Well, I mean, I think, Julio, you should take it back that, I mean, it's almost similar to the whole situation with the psych beds, because we never got an adequate explanation as to why the hospital wanted to eliminate those beds. So, and now the hospital is once again doing something else without really explaining it properly to the community.
Are they trying to sell the Allen Hospital? No, I mean, there's a lot of possibility in another hospital.
I don't think so.
I don't know, maybe Julio knows something, can we let him answer?
No, the hospital, New York Presbyterian is not selling or doing anything with the Allen Hospital. The Allen Hospital will continue to be New York Presbyterian and will continue to provide the services.
So the midwives have to reapply for what you're saying is the same position?
So the positions will now come under Columbia, and the positions have been posted, and they can reapply for those positions, yes.
Not with the same benefits?
I'm sure that, I guess one of the midwives alerted the fact that the benefits came through the union. That's why she took the position. Now, I don't know exactly what those benefits with the person will be. So I really don't know.
I think that's what they said.
Could you find out for us?
Well,
I could look at the post, sure.
Yeah.
No.
Yeah, but that's really, I mean, it's sort of self-evident that they're not going to have the same benefits, and they're going to lose their pension rights. I mean, it's and then when the hospital offers in this letter to work with you to secure another position at the hospital, are those positions that would give them the same benefits as what they've had up to now?
Steve, I would need to speak to HR to see exactly in terms of the benefits, and whether I assume will continue to be within NISNA. So, but I would need to find out exactly if those benefits as they transition to another post will be the same.
Yeah, well, I would appreciate it if you would let me know.
Sure.
I mean, once again, though, this is like just a huge mystery as to why the hospital does some of the things that it does.
That's why I asked if they were planning on selling.
But are there any other questions?
No,
All
I
right.
think you said it right.
All right, well, thank you. Julio, appreciate the fact that you came to the meeting.
I want to say something, not related to. Okay, a number of years ago, probably over 15 or 20 years, Montefiore Medical Center took over Bronx, Lebanon.
No.
And this
Bronx,
was,
Lebanon?
yes, they took over Bronx, Lebanon. And this was because the at least part of the hospital was, I don't want to say failing, but they had some mismanagement and something happened. So the Department of Health stepped in and asked Montefiore Medical Center to take over, which they did. This is why I asked if New York Presbyterian is planning on shifting responsibility, meaning giving management to another hospital. I don't want to say, maybe selling is not the right term.
Okay, again, there's no plan for New York Presbyterian to divest itself of the Allen Hospital.
All right, well, that's pretty clear. Okay,
Okay.
all right, thank you. Next, Diane Ashley, thank you for holding in, staying with us. You have your report?
I do. Thank you. Happy New Year, everybody. As of January 4th, so as of today, we have 11 residents who are positive for COVID. Again, on state mandated temporary isolation, largely asymptomatic. We continue to educate and offer COVID vaccinations. You guys asked me to update the information correctly for the new vaccine. So 46% of our residents have received the COVID-19 Comirnaty vaccine. I hope I said that right, but the information is correct. And the other piece I just wanted to report is that we just completed participation in a program with SkillSpring to offer young adults in the community the opportunity to train to become CNAs. Last month, we had 14 graduates coming that were part of the Isabella cohort.
One second. You can't just use these abbreviations.
I'm sorry, certified nursing assistant.
Okay, thank you.
And I apologize. And so there were 14 graduates in the Isabella cohort. They're all coming to work at Isabella. Obviously a win-win with, staffing challenges across the board in healthcare. They'll be coming to work for us, and we are opening the door to a career path that might not otherwise have been presented. This program has been judged to be very successful, and we plan on doing additional cohorts and moving forward with it.
Again, for this program.
I'm sorry.
No. Finish your report.
Oh, no. I think that's about it. I'm happy to answer any questions that I can or go back and get info.
Okay. Are you following the lead of the city hospital system in requiring masks?
I have to double check, but I believe, and I will double check this. I believe out of an abundance of caution, we have required staff to wear masks continuously and never removed that requirement. I have to look. It was not one that we had to do, but I believe we have been exceeding.
Right. Well, apparently
I did send a note asking, but hold on, no, I don't have the answer.
Okay. Well, evidently the city hospitals are now requiring anyone entering their hospitals or nursing homes to wear masks. So they've taken it a couple of steps beyond just the staff.
It's funny in a separate thing, because we're working on a communication to family members about not coming to visit if they've got a respiratory, one of those kind of notes. Right. I did add it. We looked at the one that we sent X amount of months ago, back when everybody had to, and I literally, before this meeting even started, sent a note out and said, what are we doing? Have we added family members back in or visitors back in? So I'm actually waiting for the answer on that. I thought I might get it before I reported, but it did not come in.
Okay, very good.
I can certainly send you a note and let you know the update so you can put it into the minutes. I just have to ask.
Good. Okay, well, that would be great. Was it Heidi or Carmen?
Diane, can you please repeat the name of the program that you just mentioned? And also, what do you consider young adults to be?
I can't define young adults for you, only because I don't know that level of information. Okay. So I can certainly ask for more information. It's the program is in conjunction with SkillSpring. And let me just see if I can pull something up quickly, because there was some coverage about the graduation that took place actually at New Jewish Home. And I'm just, hold on.
Well, maybe if you have the article, you can share it in the chat. We can look at it.
I'm not sure that I am technologically astute enough, since it's sitting in my text messages, to pull that off. But hold on a second. Yeah, it's SkillSpring, and the program was created a number of years ago, and it was to create a career path into nursing for financially insecure young adults in New York. It doesn't define what young adults is. I think the program started with New Jewish Home and SkillSpring. And so Isabella has now joined that, and we just graduated our first 14 in our cohort, and very pleased, and we'll be hiring all of them.
Awesome. Thank you so much, Diane.
All right, very
You're
good.
most
I just looked this up real quick. In their
Oh.
website, they say that the young adult program is 18 to 24.
Oh, nice.
No,
Thank you so much.
Okay, that definitely sounds like young adults.
It's a
all right.
team sport. I appreciate the lift. Thank you.
Thank you, Jacob. All right, no more questions for Diane. We're on to old business. So the latest street and sidewalk cleanliness ratings. Where are we? Right here. Okay, so for the latest statistics are available for the month of November. And they found 91.3% acceptable streets in Washington Heights and Inwood. My end of Washington Heights was at 100%. Inwood was not so good. Inwood was at 76.2, dragged down the rest of the community.
Shame.
Yeah, shame on Inwood. So we ended up with a mere 91.3%. But and on sidewalks we were at 95.1%, which seems awfully high.
Seems awfully high.
Yes, yes. So on recycling, the latest recycling statistics for the month of October show that our diversion rate, the percentage of the waste stream that we're recycling, has been holding pretty steady. In October, it was at 15.8%, and a year ago, well, a slight increase. A year ago, it was at 15.5%. I finally got a hold of the final results of our budget, our annual budget exercise for Community Board 12.
Steve, I have a quick question.
Yes.
Because you mentioned 76%. Can you reiterate what's the criteria again for the rating? That does sound low for Inwood.
Well, I'd have to look up how they determine, like how many pieces of litter, they look for. I don't know, but they have some kind of a system.
The reason why I ask is because I work a lot with like the assembly persons out there, and they're always doing like cleanups, and I'm just curious, like specifically in Inwood. So 76%, like I would love to see. Like I couldn't get that, right? Like where is that, like readily available, like online?
Well, this particular statistic is available online, but there's no further backup.
Is that the Department of Hygiene? Like,
No, it's Department of Sanitation.
Thank you.
And then you have to look under, there's a tab that says resources. Hold it a second. Forget what I just told you. It's not sanitation. It's under the, you have to go to nyc.gov/operations. It's under the Mayor's Office of Operations. And this is a program called Project Scorecard. So there's a tab when you get to the home page, whatever it is, for Office of Operations. You have to look for the tab that says it either says performance or observations. I think it says performance. and then there's maybe a further tab that says observations, and then you look for the latest result, statistics.
You're correct.
I am
It looks
correct.
exactly like that.
Okay.
Can I email myself the link, or can you email me the
Yeah, I
link?
can.
Yeah, okay. All right, good. So you can look these up, everyone. All right, so the exciting news, did we, I don't think we've seen this yet.
We ranked really high. I
Well,
just
we
saw
did
it.
amazingly well.
Yeah.
Our committee was given real respect. So on the capital budget, all four of our capital budget priorities were in the top 10.
Wow,
No, it is incredible. It's never happened before. So obviously this
Must
was.
be the new members on the committee.
Say that again.
You don't make me hangry.
I like that one. Five. Yes. We're vocal.
Well, let's be careful because the other committees may be claiming that this was a rigged vote. So the continued replacement of old water mains and sewer lines in our community was ranked as the number 3 capital budget priority.
Good job, Wilson.
Installing green infrastructure such as bioswales was number 5. Providing additional garbage collection trucks and street sweepers was number 7. And number 9, my favorite is was to expedite the construction of the new garage for District 8 and relocated trucks from our community. And then on the expense budget, we also did incredibly well. 6 of our 9 items ended up in the top 10. So, and once again, the number 1 priority for the board as a whole was the need to expand mental health services and outreach to the community.
This was number 1 for the first time.
No, last year it was not number 1, but for 2 or 3 years prior to that, it was always number 1. It was also number 1.
Really? I
Yeah.
thought land use always get,
No, what are you talking about?
okay,
No. So the number 1, once again, mental health services recaptured the number 1 slot.
Mhm.
And number 3 here is provide funding to ensure that all the local public schools have multi-service health clinics. Number 5 on the board's list was to increase services to prevent and treat chronic diseases such as dementia, diabetes, cancer, heart disease, and hypertension. Number 8 was to increase trash basket collection on commercial streets. Number 9 was to increase substance abuse services in the community. And number 10 was increase pest control efforts to eliminate rats in our community. So we did really well here. 6 out of the 6 of our items in the top in the board's top 10 list. What that means in the overall scheme of things, who the heck knows? But it's nice to see that the board as a whole has given considerable credence to our priorities.
well, noise enforcement cameras is not really in the bad spot. Number 16.
That's pretty good too.
What?
That's pretty good too.
Yeah.
It is kind of in the middle of,
Well, actually, there are so many, I don't know what the total is. The total is on, we have, what is it? Over 50, we're not supposed to have so many expense budget priorities.
45, I think.
Yeah, it's ridiculous. But yeah, to have a number 16, you're right.
It's pretty good.
Yeah, not bad.
Let's give ourselves credit
Yeah.
here.
Yeah, it looks like there were 56 expense budget priorities. A little unclear what it is. Okay. All right, very good. Any other old business?
Yes.
Yes.
It is. So when I was here last time.
Well, I'm sorry, tell me your name again.
No, me, it's Heidi.
Okay.
So when I was here last time, which I think was maybe the 3rd or 4th time that I was here, you told me to reach to Ibn Smith.
Right, our district manager.
He told me that he will take care of it in his own time, whatever that means. So I'm here again, and I would like to take this seriously, if possible. I have an idea of how to go about it. My Xerox machine broke, so I only have one copy about the DNA in Tel Aviv.
Oh.
It's like the whole DNA thing is like, maybe it's not simple, but it's effective and it can bring money to the city. Like, it's almost a no-brainer.
This is about dog food.
Dog food.
I didn't know they do it in Tel Aviv.
Well, what it is, they have the owners have to submit their pet's DNA
Right. So,
when they receive their license.
like,
And I think, well,
so in a way, it's like going a few steps back, right? But can we do that?
well, I mean,
Okay.
I don't know if we could do it, but my sense is that the people who are really creating the problem could very well be people who don't bother to get dog licenses.
That's very true.
So I was gonna ask in relation to that, what percentage of dog owners are licensed, I mean, like, are getting licenses? And, it's an interesting conversation because, there is actually a calculator for that. Right, and I found it not relation to that. I found it was something that is relation to, vet services for, low-income pet owners in our district. So the, American Veterinary Association has a calculator for that, has a calculator for number of pets and all of that, but
Yeah, but how do you know how many pets, how many dogs exist? I don't-
right, so they have a calculator.
Well,
But what we should do, or you could definitely do, that anyone can do, is foil go to Department of Health and foil that information. How many dogs, Freedom of Information Act, right? Law? Act, law.
Whatever, yeah.
And you have the right to know how many dogs are licensed in, I don't know, go by zip code, which is better than New York City. And they supposed to provide it. I think they should provide it in 30 days, not sure. But that's
I mean,
something.
it's,
That doesn't
I mean,
acknowledge what Steven is,
yeah,
like,
yeah.
we don't know how many people do not have licenses.
yeah, how many, who the hell
There's
knows
many
how many
people that
dogs?
don't register their dogs.
Yeah, I mean, and during the pandemic, apparently, people were going wild, getting dogs.
Right, but this is when I said that there is a calculator for that.
I mean, let me talk to Ebenezer. I don't understand why he can't just ask the sanitation police to go over to, Haven Avenue at 171st Street and check on, I mean, what is the big deal about this?
But there is more, something needs, like, if the
Yeah.
inspector goes to Haven Avenue, a dog has to come by. A
Right.
dog has to
Yeah.
have,
Right.
it's like, what are the chances of it? It's
Right,
very
well,
futile.
Yeah, well,
But like, can we think about a way to do something about it, to start from zero and like to get to like owners that don't have licenses? How can we enforce that they will have a license, even if they have a dog? Is that possible to do? Second step, dog owners that do have a license, let them submit DNA. Let's have an agreement that it's a good idea to do. Do you go through the city? Do you go through Eric Adams? What do you do? Like you people, you know more than me. I'm a little one. Come
No,
here.
actually, you know more than us.
Yeah, I agree. But can I say, I'm
Yeah,
sorry,
no,
so, you know, I'm gonna say, I second what you say. I think first, because this is the third time you've been here, so I would recommend the first, like, maybe we don't know how many unlicensed dogs there are, but maybe a first step would be to at least identify how many licensed dogs there are, and maybe rally some community support yourself. If I'm sure there's a lot of people that live on the Haven Ave, maybe do a petition, maybe get some local support and come back with more data. I would recommend that.
So my thought, and I'm done, and I'm just, I think it's very hard to enforce these things. Very hard to determine who, I mean, we have enough trouble just trying to enforce basic gun control and all of those things. I wonder if we're looking at it from the wrong direction. Instead of trying to enforce licensing and DNA testing, maybe we need to go back to my litter campaign problem and, you know, really start to look at our sidewalks. Really, your concern is dirty sidewalks. So do we need more garbage receptacles on every street? Do we need more dog poop bags where you get one, you know, right now it's a big slot and you can take the whole bag of poop bags out in one felt swoop, which happens all the time in our neighborhood. And then what I would like to do is to have mandate on sidewalk cleaning, you know, that our buildings not only, I mean, you get in trouble for a candy wrapper on the sidewalk. Maybe buildings have to be required to hose down their sidewalks. Where I don't know how you enforce that. And I think, but if you could start to maybe get a machine that cleans sidewalks, just like we have machines that clean streets, you know, instead of trying to put the responsibility of enforcing a licensing and a DNA testing, that we need to maybe approach it from a different.
But I think my experience of it, my visceral experience of it, and like those offenders, like the bags will not do anything for them. Like the people who do that, and it's getting worse than it was, and it really is. Like it's people who don't care. Like it's not.
Yeah, then I don't know, you know, then I think we're just stuck, right?
But that's when, you know, when people don't care where they park the car, they get a $120 ticket, you know, and then they're more careful.
Well, I'm going to sanitation camp starting March 8th, so maybe I'll come up with a brilliant idea.
No, but giving tickets is a start. Give it tickets in general, but
No, but she's right, you have to catch them.
right,
Yeah.
it's just like what.
But if you have the DNA system, you don't have to catch them. You have a manpower to do that. Somebody somewhere in the city must acknowledge that it's a brilliant thing. And in Tel Aviv, in the end of the article, if you wrote, they have a hotline that people complain. Like we in New York just accept that this is the hell that we live in. I don't understand, really.
I'm surprised I have it over there. Wow.
You know, somebody who lived in Gibraltar told me that they have to have a special spray with them, and when the dog pee, they have to clean it. And if they don't, they get a fine.
Oh, yeah, I wish they would do that too.
This is not just aesthetics, it's health.
Yeah. No, listen, we got.
Especially, well, the thing that I'm thinking of is parvo. There is an outbreak of parvo. Parvo is dogs are getting parvo. It could be a deadly disease. And so, this is something to talk to HCC, may have idea about that.
What's HCC?
Animal Care Center.
But I want to do something through you.
Well, are you're in touch with them?
I could speak to them, yeah.
Yeah, why don't you see if they have some kind of suggestion?
Yeah.
How, this is the idea I have, and tell me if it's permitted. I would like to take the logo of Community Board 12 and write a flyer that says, Community Board 12 is in the process of figuring out how to, whatever, you know, I don't need to say the whole text, but you get my idea. We're not saying that we're doing it, we're not saying tomorrow we'll give you a fine, but we're saying we're in a process of figuring it out. Maybe that's a deterrence as a first step to hang those posters where in dog parks, in parks, in certain places where a lot of people see them.
Well, actually, I don't know that would be very effective, but the sanitation department has signs which certainly have a stronger message that say, you know, you get fined if you don't pick up after your dog.
Obviously, people ignore it, and it's okay. people bring big dogs on the subway. I approached policemen and I asked them about it. Nothing. So they say, so I was told here that a small dog has to be in a carrier. That's how you can take a dog and people do what they want.
I think, we're in a, currently the city is in a pretty bleak budgetary situation where pretty much there's cuts across the board for all city agencies. And so I think a big problem is, even if we think about ways to enforce these things, like where is the budget? If the budget is being reduced for sanitation, they have to make certain judgments about what their priorities are. And ultimately that's above our heads. So that's like part of the unfortunate thing about this,
Right, but there's no reason not to try to do something, because right now I know they're gonna do nothing, but therefore we should try to do something, at least to highlight the problem. And that may take years to have anything enforced, but it's never too early to start with something.
Okay, well, why don't you talk to ACAC and see if they have something to suggest?
I will talk to them.
I also think in the meantime, it's worth following up with Ebenezer again about enforcement.
Yes, yeah.
I know that enforcement alone is not the issue, and I do really appreciate, wanting more advocacy, and providing solutions, but I think coming at it from both sides makes sense to me.
Well, I
And also,
mean,
Ebenezer was out on vacation, just, and our office is understaffed,
No, I
so.
spoke to him about it.
So he said he's gonna do it on his own free time?
Yes.
well,
What does that mean?
I don't know what that means. I mean,
He says, I'm familiar with this problem for many years.
Yeah.
And I told him about the DNA. He didn't know about it. And then he was like, then you told me that there was a meeting. I didn't know what the meeting would be like, but I mentioned the meeting and he sort of made it clear that there was no need for me to come to the meeting. So.
That's the district meeting,
The district service cabinet.
and he said there is no need for you to come to the meeting?
Yeah.
Okay,
Yeah.
so those meetings are open to the public,
Yeah, I mean, anybody can attend them.
right?
But he should at least, did he say he would bring this issue up at that meeting?
No,
No? No.
he said he'll deal with it in his own time.
What is that? Oh, well, what? All right, all right. Well,
Where is the agenda? Did we do, I'm sorry, not the agenda, the calendar? Is there anything on the calendar for February?
See, the old signs.
Okay, the January district service cabinet meeting will take place on the 18th at 10 a.m.
So how does that
It's
happen?
right here in the office. It's open to the public.
And what will happen then?
I don't know whether she can speak at that meeting. But, I mean, Ebenezer is the one who should be raising the issue. That's really that's his job.
I really feel like, I'm like the small citizen. There is a problem. It's not my personal problem. It's many people's problem. It's a health problem. And like anybody in my shoes would have given up at this point. And it's almost like, should I give up? Like, or should I be? Or should I be stupid enough to? I don't know.
No. It's don't give up and another thing to do is maybe start a petition and bring the petition with signatures to the office and send the petition to Carmen de la Rosa. Okay, and other government officials. Start a petition.
Say that again. Can I?
Yeah, of course. Start a petition. Collect signatures.
Okay.
And bring it to the office. And also send it to our council member, Carmen de la Rosa.
Okay. When you say bring it to the office, what do you mean? To here?
Yeah.
Okay.
Community board.
Okay.
And technically speaking, that's something, if whenever that happened, then Ebenezer is supposed to report that he received the petition, right?
Well, I don't know, but but it is
in
a good
his
idea.
report.
Well, it is a good idea to also bring this issue to the council member's office.
How,
And, you know,
what is that?
she has an office at, what is it, 177th Street?
Oh, you mean Carmen de la Rosa?
Yeah.
Okay.
Yeah. And also the board president, they can get a copy.
Our president is not living.
Yes. They should get a copy. I'm not sure who else
Well, you
on
could
the
say-
city level.
Well, you could send it to the assembly member, you can send it
Right.
to the state senator, but,
Oh, right.
Especially because some of these people, you know, they can
their
get
own
levers
budgets.
for budgets and
Right.
stuff, right? So, you know, it doesn't hurt to go to as many of our elected officials as possible for that reason, because they can kind of say, okay, this is a priority. Is there a grant for more sanitation people to come, more, you know what I mean?
No, how many signatures is requested?
I
there's no particular rule.
there is no rule. You do
Yeah.
your own, it's your petition that you create. I have no idea.
Like 20 signatures is not like.
I did a petition once and I was told that it's 50 or more.
50 on it.
I don't know. It was just somebody, I mean, if you want a number, I would.
Okay.
The more the merrier.
Yes.
That's the rule, but
Okay,
I just want to say one more thing about the signs idea. The signs that you're talking about are signs that people are used to ignore. Like, you know, it's like
Well,
no smoking somewhere. Oh, okay, whatever.
well, those are at least official government signs.
Okay.
A sign that says the community board is trying to figure out something, it's meaningless. It's meaningless. Nobody even knows what the community board is to begin with. And nobody's gonna be impressed by the fact that a community board is trying to figure out something. I mean, please, give me a break.
Okay.
We don't give up.
Yeah,
Thanks.
all righty. All right, thank you.
Thanks.
Cheers. All right, new business.
I have new business.
Okay, I'll get to you in a moment. You may recall, well, you may not recall, but Mount Sinai opened up a practice up in Inwood a few years ago, and apparently closed it as of the end of December.
Wow.
And
the urgent care.
That's quick.
yeah, the urgent care, and but it was also more. It was more than just urgent care. I think they had various specialists there as well. It was more of a comprehensive clinic, and my understanding is that it was scheduled to close at the end of December. So, which I think is unfortunate, because I thought it was great to have yet another major
Right.
healthcare institution come into the community and offer services. But
Do you know why?
they evidently couldn't make a go of it.
Do you know why?
They apparently weren't getting enough business.
Where was it located? I'm curious.
Was it 5030 Broadway?
Yes,
It was, what is that, about 215th Street,
214.
214?
Yeah,
Yeah, on the
it's
east,
the old Verizon building.
yeah, next to,
Like a college, right?
next to where the college is,
CUNY in the Heights. No,
right,
yes.
yes, Trinity Heights.
Yeah.
And so it was in that same building.
Right.
That's, maybe an unfortunate, well, that is an unfortunate development.
Is there a way to find out, like, what happened?
Well, yeah, I mean, I inquired with my contact at Mount Sinai,
Mhm.
and he basically said they just weren't getting enough business.
So people are healthy in this, in this section of Inwood?
Well, they weren't availing themselves of that service.
I'm so sorry. And what kind of clinic was it? Or what were they, general practice?
It was, yeah, it was an urgent care center, but it also had some specialists, and it was I think also a general practice.
I didn't know there were general practice.
Yeah.
Okay.
All right, so Heidi, you have something?
This is with regards to Recruit Me and Columbia
Oh, yes,
University's
right.
research projects. I spoke to a research coordinator who I know. And she said that she would come speak with us only in her capacity as a private citizen, and not on behalf of Columbia's Recruit Me. They do have like a general sort of outreach arm, so we could in theory reach out to them if we wanted to have a presentation on Recruit Me. I've also gone through the process partly so I can speak about my experience to you all rather than have someone else who's speaking on their individual capacity on Recruit Me at a later date. But something I'd floated before we called the meeting to order is, it's possible that Recruit Me has like an email blast or something where they list ongoing studies that are recruiting. And in theory, the office could also circulate that list to the listserv of ongoing research studies available and seeking participants. So I will look into whether or not, but I saw that Sandra popped back up. So I don't know if she has
Yeah.
something.
Yeah, she can address this.
Yeah.
Yeah, so I would say we do have a full blown website on Recruit Me, and we do constantly, as a matter of fact, we have with our community advisory boards, we put them through the whole process of recruitment and have actually an office at 390 Fort Washington with computers helping local residents navigate the Recruit Me site. But I think that it would be helpful to have someone from that program come and present, because in this website, in this system, it's not just our studies, but really studies that are going on across the nation, giving on specific diseases and, who's the faculty member leading it and what are the eligibility criteria. It's very critical, especially for individuals undergoing rare conditions, also uninsured and so on. So I would strongly recommend, and I can definitely facilitate that presentation to have them come and present. And again, it's not just inclusive of Columbia-led research, but really research across the nation in different areas.
All right, well, that sounds worthwhile, right?
Yeah, I agree. I think something that I discussed with the research coordinator that I was in contact with is like some studies, for example, are not available in other languages aside from English, and it depends on the staff that is working, on the study. So that's definitely something I think that we're interested in, sort of like how can more people access this resource that is basically free healthcare.
Yes, we can definitely present on that, and actually a lot of the initiative that we're undertaking to ensure that there's language accuracy and it's equitable across the board. And one of the initiatives that I think this committee would also benefit from hearing it is our Pfizer initiative, where we're working on how to reach out underrepresented minority populations on clinical trials. As we know, COVID showed us that we're not in the numbers. So basically, there has been a strong effort working with local community organizations to do a lot of education on these clinical trials and how to participate, talking about a lot of the safety precautions and education. Health literacy is one of the big issue in these studies, making sure in terms of how do we get consent, and not just in the consent form language, but really working with the individuals to make sure that they understand the research study and so on. So I think both of those programs would be very valuable to bring to the committee.
All right, so maybe we could try doing that in March.
Okay.
All right, very good, thank you. Jody.
Yeah, Steve, we also talked about, you and I did, New York Presbyterian's newsletter had an article on brain health.
All right.
And I was supposed to try to reach out, which I did, two different directions with the person who wrote that article, but I've heard nothing back yet. And it was, pretty fascinating article that I think would be really, 6 million people in the United States have Alzheimer's and dementia, and 2 out of 3 are women. And
2 out of 3 women?
are women, and they're trying, and there's a lot of information on that she had on how to improve brain health, and it was pretty fascinating.
Was it Dr. Jennifer Manley?
Yeah, I think it was.
Okay, she's our
Actually,
star. She's actually with us at Columbia. She's at the Department of Neurology, and we could definitely bring her to the group, depending on when, her study has really been trailblazing across the nation. Yes.
So you think we could also get her?
Yes. So are you interested in having her speak about her research or speaking to some of the data findings? Because we have a lot on Alzheimer's. I'll look for the article just to make sure to let her know that you're interested in particular on this topic.
Yeah, I found the article interesting because it was very specific to how people can improve their brain health. And then she also spoke, and also talked about a little bit about her study, if it's the right person.
Okay.
It's very important.
All right. Very, do you have the capability of circulating that article to us?
Yeah, I can probably, I just looked at it yesterday, so I can send it to you,
Yeah.
Steve, and then.
Send it around.
And then.
Okay. All right, very good. All right, thank you. Is any other new business?
Is my business is new?
What is your business?
I see.
I don't know, well, I briefly discussed that last month and this month.
Oh, no, I'm sorry, that's old business.
So I can't.
No, we'll reopen the old business. Yeah, go ahead.
Meeting by 9:30.
So, we were supposed to discuss the issues of, no spay neuter clinic for low-income pet owners. I reached out to ASPCA, ACC, and so far I didn't get response from the right person in terms of commitment to come to a meeting so we can discuss and have a resolution. So this, I hope it will happen next month. In the meantime, I'm happy to report that I did contact Positive Tales. It's an organization that actually help low-income pet owners with some medical issues that their pet have. And they are interested, I told them about the situation that we have here, and they are interested in finding a location for vaccination and wellness clinic. So you seem puzzled, I'm going to, it's an NGO that deal with primarily in the Bronx, but they are looking to expand. And so I will contact them and have a conversation about more specifics in terms of dates, because now they're looking at the 2024 schedule and see exactly how can we have at least two clinics, maybe? I don't know yet.
So they could maybe just rent a storefront?
No, it's a one day kind of deal. It's like pop-up kind of clinic.
Oh.
They usually, but they can't show up on the street. They need like a facility, like, for example, a building. Like, I don't know, I have to look for something. Could be a church, a school. I'm sorry?
The old Boogans. I'm
Could be.
making a bit of a joke.
Well, it's certainly available.
Right, so, and the reason for that is because the number of unfixed cats pets, not just cats, in our district is alarming. And I will use the calculation by the Veterinary Association and to calculate how many pets we have by zip code. And let's see, we hope to have, the ASPCA is the major player. There is also a Toby project and other, but definitely would like to start with some clinics and see if they can do like spay neuter clinics, also wellness, also surrender prevention that ACC is doing, but not in our district. And all of that important stuff to make sure that people are aware, because last year alone, 2023, for those of you that don't know, I'm a cat rescuer. I took 156 cats from zip code 10034 to get
How many?
fixed. 156.
Oh my God, wow.
And that's nothing. I can't, and people are contacting me from Washington Heights, but I just can't. I'm one person.
These are cats that you just found on the street?
No.
Oh.
Okay. half of them are own cats.
Oh.
Okay, the rest of them are feral cats that we're not talking about rescue issues in that resolution. We're not talking about feral cats. This is rescue issues are totally separate. The goal is to have a clinic in our district. ASPCA had one, but they shut it down in 2019. We were supposed to get a clinic in 2021 and we didn't. The Bronx got one in 2022, and I don't want to take anything from the Bronx. The 2022 Brooklyn got one, and there is no plan right now to have anything in Manhattan, even though we have nothing. We are the only borough that have a zero option for low-income pet owners.
And are these clinics operated by the ASPCA?
Either the ASPCA, ACC had some clinics. There is the Toby Project. There is, in Brooklyn, they had two other options, for low-income pet owners. And the ASPCA are also running the mobile van in some of them in the Bronx and some of them in Brooklyn, but not back in Manhattan. They're not here. And it's a serious problem. We need to address that, and we need to ask the ASPCA for a brick and mortar clinic. But in the meantime, we'll start with.
I have a question. The clinic, is that privately owned? Is that like a possibility? Like, are there private owned clinics?
We have 3 veterinary clinics in our district. 3
Which are privately operated.
privately
Yeah.
operated.
But the one you're saying would be managed by the public entity, right?
Well, the ASPCA it's not really a public entity. It's a private nonprofit.
Right, but they do get funds from Department of Health.
Yeah, okay, but yeah.
Depending on, to run some programs. And so do ACC is being funded by New York City, by the mayor. They
Yeah.
have a contract.
Yeah.
Okay.
Yeah.
So those are more, we can ask more from ACC than ASPCA. ASPCA doesn't owe us anything, but since they're getting funding and they're operating in other boroughs, then we should ask to have something running.
So we should add this as one of our budget requests
Yes,
In-
absolutely.
in the future. Yeah.
In the future.
Yeah.
And I spoke to the Porfirio from the board president.
Right.
And he wanted to see the resolution, like the draft, and I said, I don't have it ready, so it's all gonna happen next month. Yes.
So this is not just related to what you're saying, but this is related to all these topics. We do not have an American language of logistics in which we can have a common language. Imagine the future common man and common woman. They're trying to digest this language and understand. It sounds stupid. Right? It's fucking stupid. I'm sorry, excuse my language.
Okay.
It's fucking stupid. From the point of the.
Okay, Ryan.
I know,
Ryan,
but this is my
Ryan,
point. My whole
Ryan,
point is that if it's
no.
a low cat, hold on.
Yeah.
If this is I'm trust me, I'm concerned about it. If this is a low income cat owner, then maybe they need to financially understand that, hey, you know what? You're not capable to have a cat. You're not financially capable to have a cat. You should let go of your cat.
No. We're going in the wrong direction. This is actually
Right.
should not, a
Well, I'm
low
just saying, if you're
income.
low income,
No.
you might not be able to have, it's like saying if you're homeless, you have a dog. That's not
So
right.
low income residents should allow to have pets if they choose to. And there are programs that run by ACC that can allow them to give, like, for example, like free food. They're not here. They're not in our district. That's the problem. So the problems are already there.
Yeah.
The only question is like bringing those programs to our district.
Okay, so at this point,
Yes.
we're holding a spot on the February agenda.
Right.
For this issue. And I'm also planning to have Kit Kennedy from the Natural Resources Defense Council.
Okay.
Talk about energy and related issues. And then we have the possibility of Chris Nickel talking about his farm.
Yes.
Providing produce for residents of northern Manhattan. We have 3 possibilities for February. All right, are there any announcements?
I have just two questions really quickly, because and I wanted to mention it earlier. I just wasn't curious. Pardon me, I didn't want to mention it, but I just because you mentioned it now. Is it possible like clinics like that, or even like with the Allen Hospital situation, because it's like let's say for example, it's the majority of the business is predicated on low to moderate income, and Manhattan is not as much low to moderate income population as opposed to the other boroughs. Is that maybe perhaps the reason why we don't have a clinic? And then the second question is that a reason why, let's say, for example, at the Allen Hospital, they'll eliminate midwives maybe because there's not enough revenue to support it? Like, is that something? Because I know that they already posted a job, no union. So I'm assuming they're probably saving a lot of money by doing this. So maybe does that factor in to like these?
Not for,
Well, that's,
talking about two different things.
yeah, right. Well, in terms of the Allen Hospital situation, that's certainly a suspect reason why they may be making that change, as the union representatives brought up. But I certainly don't think the Bronx is probably the borough with the highest poverty rate. So the fact that it has one of these clinics and Manhattan doesn't, so that doesn't quite jive. I mean, why, it's
The response, one of the responses from a representative from the ASPCA I spoke to is that, well, the rent is expensive in Manhattan. I said, come to our district because it's cheaper than paying rent downtown. And this is where the services are needed, right? The residents of the Soho don't need the ASPCA clinic, let's face it, right? So they need to be where the services are needed, and we need those services.
Yeah.
Because
I know you mentioned like the funding comes from like the
some
state.
of them,
So that's why I was curious, like you mentioned, like if there's higher poverty, that's a justification to, like, I'm not sure. I'm just kind of like throwing stuff out there. Like, I'm just curious as to like, oh, maybe we don't have a clinic because we don't have enough, let's say, poverty or low to moderate income to support the grants that they're getting. So they're like, oh, hey, we get more money if we place it in the
but
Bronx.
they had one. They had a clinic on 92nd
yeah, for decades.
for decades.
And they closed it.
Closed it in 2019.
Well, you know why?
Well, they wanted to move elsewhere
Well,
because
I think they sold that site and probably didn't it become a development site?
no. There is no. You're talking about next door site. It's a storage space. It's no.
That 92nd and what, First Avenue?
92nd and between First and York.
Yeah.
Yeah, no,
No?
it's still there.
No.
The adoption center is there, the hospital is there,
No.
all that is there. And when you call them, if you call the ASPCA right now, they will tell you that if you are a resident of the Bronx and Brooklyn, you can get services at those clinics. But if you are in Queens, Staten Island, and Manhattan, you should go on the ASPCA website and they will refer you elsewhere. This is not the answer. I'm sorry. If you get
No.
funding from the Department of Health, I want to hear.
No. I'm learning.
But they actually limit the people who can go to the ones in the Bronx and Brooklyn only to those boroughs residents?
Right. And only for those that earn $50,000 a year or less.
Oh, okay.
Which is fine.
Yeah, that's
It's
okay.
low
Yeah.
income, right? This is totally fine. But we have many, and I'll go to the census, we'll have many Inwood, Washington Heights residents that earn less than $50,000 a year. So, I mean, we need those services here.
All righty. Okay, it's getting pretty late. So I assume there are no announcements, and our next meeting is Thursday, February the 1st. We're adjourning this meeting at 9:55 p.m. Thank you all for attending, and for those of you who may still be watching, thank you for hanging in there. So take care. Good night to all.
Thank you, everybody. Have a good night, everybody.
Good job, but until we speak about the language, it's not getting.
Do we hang up there? Do we hang up here?
It's like saying you're.